Hello, everyone. I think we start. So first of all, warm welcome to this policy conference where we will address the important question of health impacts of climate change and discuss opportunities for how we can take action to limit the health effects of global warming. We are very happy that we have representatives from the European Commission today, and it's good to see many people are interested in this topic. In the coming hours, we will present some of the main findings and policy recommendations coming out of the NBEL project, which is the project behind this conference. Maybe not all of you have the NBEL project under your skin, so I'll just say 2 words about what is the NBEL project. It's a coordination and support action funded by EU's Horizon 2020 program, and it has gathered representatives and partners from 12 different research projects addressing climate change and health across the world. These projects, individual projects, are funded by the Belmont Forum and the Horizon 2020 program and some additional international funding schemes. And through various networking activities, synthesizing of outputs from the different projects, and by translating knowledge into, hopefully, actionable policy advice, we aim to bring lessons from the research projects to the table of decision makers in Europe and beyond. The Earth's climate is changing, as we all know in this room, and the impacts of human health and society is getting more severe year by year. As recently reported by EU's Earth Observation Program Copernicus, the Northern Hemisphere summer of 2023 was the hottest on record. According to the first UNFCCC global stocktake, the window to limit global warming to 1.5 degrees is closing rapidly. The recent 2023 Air Quality and Climate Bulletin, issued by the World Meteorological Organization, puts the spotlight on heat waves and draws attention to the fact that it is not just hot temperatures which is a hazard, but also climate-related increases in air pollution, not the least from wildfires, which have severely impacted air quality in many regions the last years, not the least this summer. We should not forget that as of today, air pollution is the largest environmental killer, globally as well as in Europe. It's becoming more and more evident that air quality and climate change must be tackled together. Climate hazards and environmental pollution, however, do not affect everyone equally. Increasingly, research demonstrates huge variation in impacts of specific hazards and climate events. The projects gathered in NBEL are contributing to increased understanding of which factors make some individuals and some groups, some regions, more vulnerable to climate change and hazards than others. And as we shall hear, we address the need to take this knowledge into account when developing policies and interventions. A range of greenhouse gas mitigation policies and measures have been put in place in Europe and beyond, and adaptation strategies are being implemented to strengthen resilience and reduce vulnerability to climate change. However, the scale and pace of mitigation and adaptation is not adequate and needs to be significantly accelerated. While there is a rapidly escalating sense of urgency around the need for action on climate change, funding for continued use of fossil fuels far outstrips support for climate change mitigation and adaptation. The externalities of emissions of greenhouse gases and air pollutants and the benefit of climate action, be it mitigation or adaptation, are evidently not properly accounted for. Moreover, financial flows that do target climate remains heavily focused on mitigation, and funding for adaptation is lagging behind. It cannot be stressed enough that mitigation and adaptation must go hand in hand to protect human health in all regions of the world and to minimize trade-offs and avoid maladaptation. While there is increasing ambition in plans and commitments for adaptation action, most observed adaptation efforts remain fragmented, incremental, sector-specific, and unequally distributed across regions. Thus, it is increasingly important that we, in the science community, delivers in a timely and policy-relevant manner evidence on the impacts that are already observable, impacts that are in the pipeline, and to what extent climate policies may reduce future health risks. The NBEL project and its partners aims to make its contribution to that end. Thank you.
Thank you very much, Kristin, and good morning, everyone. Wonderful to see all of you participants here in this room and also participants online. My name is Ernst Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, and I'll be your moderator for this morning. I'm stepping in for Sonja van Rensen, who unfortunately can't be with us this morning on short notice, and we're sending her all the best and hope to welcome her at the next event then. My organization, HEAL, is an alliance of over 90 member organizations working for better health through healthy environments. And we have been an organization who've, for over a decade, underlined the need to place health at the center and at the core of all climate efforts, both for mitigation and for adaptation. And I think with everything that we're seeing, with the climate crisis accelerating, this call to consider health and to protect health has lost nothing of its relevance today. And it's also something we'll be talking about here this morning. We're pleased to have been a partner in the EU-funded NBEL project to especially bring forward the science and translate it to the policy context and bring it forward to decision makers. And this is very much what we want to do together with you this morning with the presentations that we're hearing and the panel discussions. And yes, together with you in this room, but also very much online. So this is supposed to be very much an interactive exchange here this morning. And we invite you to use, for those of you in the room, to put your questions. And those of you listening online, there'll be an opportunity to share your concerns and raise questions via Slido. And we'll get to that at a later stage. I think it's very important to keep having that conversation on how to best protect health in the climate crisis, and not to remain in a state of depression or despair, of anxiety, which is also, very normal and very understandable when we're seeing the events unfold, and especially when we see what is happening in Europe with another summer of record temperatures and of extreme events. But it's very important that we keep on acting, we keep on working together and acting to urgently continue to strengthen people's resilience, to continue to adapt, but also very much continue to mitigate, because both is needed, the adaptation as well as the continued mitigation. So with that, we have a range of presentations for you here this morning. But first, I'm very pleased that we have two keynote presentations, two keynote interventions from the European Commission to kick our conversation off this morning. And I would now first like to welcome Ms. Elina Badram, Director at DG Climate Action at the European Commission. Thank you for being here. The floor is yours.
Thanks very much, and good morning to everyone. I'd like to start by thanking NBEL for organizing this very timely and important event. Coming at the back of the summer, the record-breaking summer, the last 3 months being the hottest on record, after the fires and floods in Greece, what we saw in Slovenia with landslides and the devastation is something that's become very omnipresent in our realities. I think anyone claiming today that EU is somehow immune to these eventualities will be proven wrong, has been proven wrong. It's also clear that these impacts, they will continue to intensify, and we need to make our utmost efforts to prepare our society and different sectors, including health sector, to that reality. And I think it's very much, as was said previously, it's a balance between prepare and prevent. With prepare, you of course need to cushion your society against the impacts that are already unavoidable. But with prevent, you continue pursuing mitigation efforts that allow us to stay within the limits of what's bearable, what's tolerable for humanity. So both mitigation and adaptation are required as we move along. The European Commission, my DG Klima, has been spearheading the efforts in this respect through implementation of ambitious climate policies, but also by pursuing the activities that were identified in the 2021 adaptation strategy, including activities in the health sector. We have led intense effort to cut our greenhouse gas emissions and making EU climate neutral by 2050. That is an unprecedented commitment that's not just a target or an aspiration, but it's underpinned by legislation, regulations, incentives, laws, a comprehensive package that ensures that we will be able to deliver on our ambitions. And why is this important for health? It's important to health because it helps us slow down global warming so that the worst impacts can be avoided. And it also delivers on the near-term health benefits from reduced air pollution, which was already mentioned. The EU policies on adaptation, on the other hand, help us to keep healthy and well despite the impacts that are being felt if we pursue it, and indeed more systematic action, more systemic use of the science is required as we move along. A couple of words of what the EU has been doing to support local adaptation and heat health in particular. EU works as an enabler, providing policy frameworks, legislation, funding, and European initiatives that support nationally, regionally, and locally driven activities and policy development. This includes the health sector. The Article 5 of European climate law formulates a specific duty to adapt, an obligation for all the member states to pursue activities that make their national policies, local policies, more robust and more resilient at face of climate change. And I already mentioned the EU adaptation strategy. On water, on nature-based solutions, on buildings and infrastructure, we want to enable a healthy service sector as well. So hospitals, and the infrastructure underlying and underpinning those services is also resilient, and its climate impact is minimized. To mention a more specific initiative stemming from the EU adaptation strategy, the European Health and Climate Observatory is something that we take great pride on and will be very delighted to work with our colleagues from EEA with, and of course our friends and colleagues in DG Santé. These are very cross-cutting activities, and all the relevant actors need to be pulled in with their expertise. In my capacity as the Horizon Mission Adaptation, I work with the Mission Secretariat and our partners to help regions become resilient. Regions and cities are approaching health from the angle of reducing heat islands by greening their open spaces, or by improving spatial planning, but more innovation is needed also in this area. Using the resources from the LIFE program, we are also providing financial support to WHO, helping them to update guidance on heat and health action planning for the WHO European region. And also looking forward, we are going to publish the first ever European climate risk assessment, which will look at the exposure of different sectors at face of climate change and provide a basis for policymaking also during the next Commission, feeding into the parliamentary debate around the elections. And we really hope to put the seeds of much more comprehensive action in the priorities of the next Commission. At national level, the Budapest Declaration adopted this July at the 7th Ministerial Conference on Environment and Health was an important step as well. Co-action on climate adaptation with the health ministers committed to develop and implement health national adaptation plans. That's a very, very important step. And we, from the EU, stand ready to help national governments to turn these commitments into a Budapest reality. Now, looking ahead in the international sphere, this year's COP will be an important milestone. It will see the first ever ministerial meeting on climate and health. We expect great things to come out of that, including unblocking some financing for this important matter in the developing countries, where it hasn't really become a focus area for spending. We will also have DG Sante's One Health conference on 13th of November with an excellent turnout of great speakers, and health and climate will be one of the topics to be covered. And next year, our colleagues from RTD will be organizing a high-level conference on research perspectives on health impact and climate change. So we are really pooling in and building the momentum for this topic. I think it's important to note where we are in the political cycle. This Commission is winding down. We are experiencing some headwind to the green agenda, but what we also see is the growing concern of the citizen at face of increasing uncertainties relating to pandemics, relating to threats, security threats, but also relating to climate change. And I think the next Commission cannot lose that opportunity to stand up to that reality and have measures and policies in place that truly make our citizens feel like we are prepared and that we are preventing. So I really very much welcome the event and hope you excellent deliberations during the day. Thank you.
Thank you very much, Ms. Bartram, for outlining the EU policies and frameworks that we're looking at when we're considering climate change and health, and also pointing to initiatives or ongoing actions where the evidence that you'll be hearing this morning can feed into, and that indeed we're at a very important policy. What has been presented here this morning is also very relevant for the upcoming EU elections and then the next cycle of EU policy making. I mentioned earlier that we want to have this morning as an exchange, we want to have a conversation, and that very much includes also bringing together the health and the climate community. So now we've heard from DG Klima, from the climate side, and I'm very pleased that with our next keynote, we'll hear from the health side, from DG Santé. So a warm welcome to Mr. Philippe Roux. He's the head of unit from DG Health and Food Safety at the European Commission. The floor is yours.
Thank you very much. In fact, the bar is set high by my colleague, so you will hear some repetitions, I think. And I think that's simply normal, because we are the same Commission, and that proves that we have a minimum of coherence against what was said before. So just perhaps to set scene, and so that you know better who I am, I'm indeed having two hats. At the moment, I'm at the same time acting director for health, but I'm also head, as it was said, of a unit working on cancer and health in all policies. So in a way, covering a lot and knowing little about all these subjects, because you can't be an expert in everything, and those of you in the room who are experts know it very well. So I pretend nothing more than being an honest broker. So now you know more about me. I can try to go through the notes that my colleagues kindly prepared to me to interact with you today. as my colleague rightly said, I mean, now no one can say that they don't see that there is something happening. I mean, we have seen last year heat waves which killed more than 60,000 people. We have seen this summer the hottest measures on the continents with 47 degrees Celsius, that in Italy, in Spain and Greece, so places where people normally enjoy holidays, but here it was terrible, and that, of course, did trigger to wildfires, but also exacerbating water stress. And that has, of course, impact not only on livelihood, but on human health, on people. And we also have not only fires, but on the other hand, we have also witnessed devastating floods, first in the northeast and central Europe, and now in September in southeast of Europe. So people again were killed and livelihood destroyed. So whoever now says nothing exists, there is no problem, I think it's very difficult to defend as a position. And I think it's really warned us that the world must really enhance its resilience to climate change and boost its capacity to react to climate emergencies. And I'll come back to that later. We need to be able to react on climate emergency, but also go beyond that, because we can't just live on crisis after crisis. I think that's an important message. So we have indeed to work at all levels to ensure that we can do both. So, as my colleague said, I mean, we have an ambitious goal of global neutrality, and we, as much as possible, work to enhance our adaptive capacity, strengthening resilience and reduce vulnerability to environment and climate change. And that's, of course, in agreement with the Paris Agreement. I think what is important to mention here for me is that we do not only financially support the member states in their adaptation efforts, but we also want to make sure the fact that the strategies are really targeted and successful, because that's, for us, something which is very important. We learn it the hard way in the health field. And as my colleague mentioned, a very concrete result of the thinking in the Commission services is the European Climate and Health Observatory. First of all, because in a house that was known as the House of the Pillars, and with dungeons very separated. I mean, we proved a couple of years ago already that cooperation was possible between different DGs, but also with agencies, because what my colleagues perhaps did not mention, but it's that we are working with the on that project, and that's an important one, and it's a very great cooperation between DG Klima and DG Health. Sorry to insist on that, but for me, who is a dinosaur in the Commission, it's really something that I appreciate, because I've seen for long battles between the DGs. Here we are trying to see how we can join force, and I think this is a good sign, and perhaps a good example for the member states. So this observatory provides access to a broad range of information related to climate and human health in Europe. And what is interesting is that we don't reinvent the wheel, but we are tapping into evidence and expertise provided by leading international organizations working in the area. So we're not only the three, I would say 2 departments and the agency working, but we're also working with the CDC, with the WHO, with the Copernicus Climate Change Services, and the Lancet Countdown, and this is just among others. So we created the biggest possible group in order to ensure that in one place we can have what is necessary to reflect and think on what is the best approach and what are the best responses that can be built. In 22, the observatory released a report focusing on heat and infectious diseases. I think we now have the same type of report that is produced this year on water. So it's very, and I really invite you to look into these reports, because they not only prove that we can bring together data and information, but it confirms that by putting things together, we have more than the individual things separated here. So perhaps more elements of solution to come. Now, what is very important is that from the health perspective, one of the most important consequences of climate change, apart of heat stress, is a spread of vector and waterborne diseases. And we have learned it all the hard way with the COVID pandemic. Infectious disease do not know frontiers. So that is something we need very much having in mind. I mean, whatever are our fears, individuality, viruses goes across. Whatever you think, whatever you try to block, you can build the highest wall in the world. I mean, they will pass. Human may not, but the viruses will. So what we did within the Commission, one important element, I think, is the creation of a strong European Health Union. And that's very recent for us. And the objective is really to better anticipate emerging threats and to inform policy and decision-making and operational processes, so all the level. Our key instrument, of course, in this area is a new regulation on serious cross-border and threats to health. This regulation enhances the European Union capacity in prevention, preparedness, and response planning. And response planning is really an important element in here. It improves epidemiological surveillance and coordination and strengthens early warning and responses, now including biochemicals, environmental, and climate-related threats. So, as you can see, we are going wide. Another important element, One Health. I mean, in general, the Commission is aware of the links between the health of people, animals, and ecosystems. Therefore, we try to translate that into concrete elements. So not just to say, yes, there is a link. No, what we try to is to apply consistently a One Health approach, and with an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And I think that is one element for the future, which is very important. So the One Health dimension is something we need to think of and push forward. So, and also by mainstreaming One Health, it helps better prevent, predict, and detect, and also respond, therefore, to global health threats. And that we can promote sustainable development at both global and EU. So One Health, keep that in mind. Now looking at, I would say, what I called European vulnerabilities. As I said before, we cannot only follow an adaptation strategy that solely relies on emergency responses. Our societies are getting older. Well, I just turned 60, so I can tell. And the incidence of critical health conditions, such as cardiovascular, respiratory diseases, or mental health disorders, is on the rise. Not all linked to being older, but this is one key element also. So we live longer, but living longer is not enough. I think I wouldn't want to die if it's to live another 20 years in poor health conditions. So that's one key element also to consider. So we must also reduce these vulnerabilities to raise our resilience to health threats. and in particular those that are originating from heat stress or infectious diseases. But how can we reduce vulnerabilities and enhance our resilience? One key element is to reduce the incidence of non-communicable diseases that are, in a vast number, preventable. For this reason, also, the Commission launched the Healthier Together EU Non-Communicable Disease Initiative, providing a framework of actions in 5 targets areas. These includes cardiovascular diseases, diabetes, chronic respiratory diseases, mental health, and neurological, sorry, my English is terrible sometimes, I'm tired, neurological disorders. And a 5th working strand is dedicated to health determinants, to improve health promotion and the prevention of diseases. Now, there is one in these 5 that I have mentioned en passant, as we said in French, which is mental health. And that is very important dimension because that was for long forgotten. I mean, also because mental health influences physical health. So there is a vicious circle here. So it is so important that the Commission in June this year adopted a communication in setting out a comprehensive approach to mental health, also addressing the environmental and climate change effect on human health. Because, clear, there is a big stress of people when they are confronted to these heat waves, these floodings. I mean, this stress creates really mental conditions that are terribly affecting the capacity of our citizens to have a long and peaceful life they would deserve. Now we have talked a lot about, I have talked a lot about climate change and health, but I'm also happy to see that this event aims also to address air pollution, which is another important environmental risk factor for a number of chronic diseases. Ambitious climate targets to go hand in hand with lowering air pollution, and lower emission levels are beneficial for our health. Air pollution increases the risk of heart disease, stroke, cancer, dementia, and diabetes, cause new asthma cases in children, and damages nearly every organ in the human body. So our air is precious. So at DG Santé, we are enhancing our efforts monitoring environmental risk factors for cancer through the Cancer Inequality Registry. Another flagship of the European Commission, this European Beating Cancer Plan, which includes a number of elements. And I am very proud of this Cancer Inequality Registry because it builds on the same model than the Climate Change Observatory. It's not reinventing a wheel, working together with other partners, search where the expertise is, search who can really make a difference, bring that together, and make that available to our politicians, and also being able to put it in a language that is understandable by average citizens, because we don't exist if our citizens don't understand us, which is another key element. I mean, I come from a time in the Commission where we were making Europe for the Europeans. The Europeans reminded us the hard way that Europe exists because they are the Europeans. So we need really to be didactic with our citizens, and that's, for me, a very important element. And I always say to my colleagues, if I can't understand something, forget it. It needs to be understood by everybody in Europe. This is the only way to be really impactful. So I'm very close to the end of my presentation. I wanted also just to mention that, as I have mentioned, the goals I have mentioned, we are all in the Commission, and with your support, and you are working on them, and we are not short on initiative and actions, as you could see. There are a numerous of actions I have not mentioned, but also a lot of financial effort, field of health in particular. I mean, for cancer only, we are talking of billions, where before we were talking of millions to cover the whole health domain. So I hope it is not just a one go, but that it's a lesson for the future that having means to do on the health side is important. And my colleagues mentioned one project, which is the NBEL project, which provide a sound research base to assist policymaking in taking the right step to support adaptation and resilience. And again, let me thank all the partners involved in this achievement, because that's another way to contribute to what I try to see it as a message. So if I have only one take-home message here is, we can only do it together if we want to make a change. And there is still a long way. I mean, we will not solve the problems by tomorrow. It's not true. It's very true that this Commission has put seed in a number of things. My hope is that we will continue in the same direction and in the same spirit of working together. So, my last word, thank you very much.
Thank you very much, Mr. Roux, for outlining the initiatives and the measures taken from the side of DG Sante, and especially for reminding us how important it is to work together and to overcome the silos, and giving us the example of how it was possible in the European Commission, and so how it will also be possible among civil society and the researchers. And we very much hope that this is also the outcome of our exchanges this morning. So with that, we'd like to get going on the presentations we have prepared for you and the evidence shared. We want to start with setting the scene of climate change impacts on health, something that we now started already as an introduction, and we want to take a deep dive with presenting you some stories from the fields, because in what we're faced with, it's important to bring out the evidence and the data, but it's equally important to hear the stories and to hear from people who are faced with climate change and health impacts. So I'd first like to welcome Ms. Adelaide Lusambili from the Environment and Health Governance Center from Africa International University, Kenya. Adelaide, if you could please come up here already, from the CHAMNA project, and she'll talk to us about heat effects on health in Africa, as the NBEL project was not only focused on the European Union, but also very much on the interlinkages with Africa. The floor is yours.
Thank you. Thank you, everyone. My name is Adelaide, and I'm from Kenya. I work for the Climate, Heat, Maternal, and Neonatal Health Africa, the CHAMNA project, and some of the members are here. So the CHAMNA project has been I've been documenting the lived experience of extreme heat exposure during pregnancy, postpartum, and on the newborns. I don't have a PowerPoint to present, but we have a short video we are going to present that documents some of our research findings and some of the interventions we've put in place. We've piloted on the east coast of Africa. So the CHAMNA project again took place in Burkina Faso and in Kenya, but the video you're going to see is from the east coast of Kenya. If you have any question after the video, please, I'm happy to discuss with you during lunch hour or break time. Thank you very much, and I hope you enjoyed the video. Thanks.
Kulialia kwa sababu ile joto usiku na kwa shida nakaa sasa, unaanza kumweka awe comfort, hata kwa na ile yeye yuko na stress, wewe pia uko na stress, usingizi uko nao halali. Kulialia kwa sababu ile joto usiku na kwa shida nakaa sasa, unaanza kumweka awe comfort, hata kwa na ile yeye yuko na stress, wewe pia uko na stress, usingizi uko nao halali.
In Kenya, Kilifi County is a largely rural coastal area that experiences temperatures of 100 degrees and no less than 70 degrees Fahrenheit in the summer.
Climate, Heat, and Maternal Neonatal Health Africa conducted research to understand the effect of heat exposure on women during pregnancy, postpartum, and on their neonates.
Maternal exposure to heat leads to exhaustion.
Ni kama kilomita 4 mpaka kwa mto. Asubuhi nimeenda safari 3. Ni kazi nyingi za nyumba zimenishinda kufanya. watoto sijapikia, na kuna ng'ombe pia nafaa niende nizipeleke nizichunge.
Mothers, they do not prefer to come for postnatal care because of the long distance and hot weather, and most of the babies do not get their first shot. C-sections have really increased and low birth weight babies.
Women and neonates experience discomfort and exclusive breastfeeding is not possible.
Kunyonyesha mfululizo ina shida kwa sababu chakula chenyewe pengine hakuna, nungojeu ama kule kauji, na akianza kuhangaika itabidi usimnyonyeshe mfululizo, ile chakula utakula kama kauji unampatia pia.
Babies are born with blisters on the skin and in their mouth, making it difficult to breastfeed and care for them.
Matiti alikuwa yana sweat na matiti yangu alikuwa amefura. Mtoto naye alikuwa analia, anataka kunyonya na siwezi.
Lack of greening around the homes and health facilities amplifies women's experience of heat exposure.
Paka mchana hivi ndo ile upepo anaopata ukiwa nje ndo analala kama hivi. Unamwona amelala sababu usiku wa si rahisi kulala.
Mtoto mwenyewe hachezi vizuri kwa tumbo. Nataka kulala, unapata mtoto amelala saidi moja.
Kitu yenye inachangia sana huku mazingira ya huku kwa sababu nyumba zina madirisha. Hiyo ndo napika hapo ndani, hiyo ndo nalala. Ukitoka nje pia hata hakuna kwa kukimbilia kwa sababu hakuna miti ya kivuli chini.
Pregnant and postpartum women do not drink enough water because the water is contaminated.
Nakaa unahisi kiu sana. Maji yetu hata kukunywa pia nahofia sababu afya ya mtoto wangu mwenye ako kwa tumbo sababu ni chafu sana.
Many women continue to perform household chores during pregnancy and immediately after birth.
Bibi yangu alipojifungua, damu ilichukua muda mwingi kukauka kwa sababu ya kazi nyingi ambazo anafanya na pia kwa jua ambalo linawaka huku ni kali.
After our research findings, we came back to this community to co-design with community members at different levels so that they can come up with priority interventions.
We focus on behavior change interventions to reduce heavy workload. We engage male spouses, mother-in-laws, community health volunteers, religious and local chiefs. We sensitize the community on the health effects of heat and community health volunteers to include danger messages in their daily work. Mothers-in-law and male partners pledge to support women and a public pledge from the chiefs to mobilize communities to support mothers.
Itakuwa ni vibaya na sheria itakuwa na kuangalia vibaya sana ikiwa wewe huwezi kusaidia huyo mama ambaye yuko pale na ananyonyesha. Kwa hivyo uhakikishe kwamba unatekeleza ile majukumu yako nyumbani, usaidie na yeye naye ajisikie kama wewe ni haki yake.
Kupitia hao mafunzo yenye nimepata kwa chuo kikuu cha Aga Khan, nimebadilika sasa na nimejua kuwa mama anastahili sana kusaidiwa.
Mothers are encouraged to do task shifting and perform heavy duties when it is not hot.
Sikuwa najua kuwa kutembea na mtoto wakati wa joto jingi kunaweza leta athari, lakini tangu nipate haya mafunzo nafanya kazi zangu kwa wakati, kama ni asubuhi, alafu nikishamaliza narudi kupumzika sasa.
Thank you very much, Adelaide. If you have any questions or comments, we don't have time now because we have some presentations to get through, but there will be a moment and you can already start sharing your thoughts on Slido. I would now like to welcome Andreas Flores from the University of Thessaly in Greece, from the Heat Shield project, who will talk to us about the heat effects on workers in Europe.
Thank you very much for the introduction. Can you put my slides on? Yeah. Oh. Doesn't do anything.
You should be able to
you. In a typical summer day, 2 workers were asked to swallow a pill, like the one you see me having here, and this pill records their core temperature, the temperature of the body during their work shift. And as you can see, one of the workers throughout their work shift had a core temperature hovering between 37.5 and 38. This is like having a mild fever, although still is below the safety threshold of the WHO, which means that this worker was below, he didn't have a high risk level. The other worker, as you can see, had the core temperature almost the entire time above the safety threshold of the WHO, meaning that, and even reaching nearly 39 degrees Celsius. The irony here is that these 2 workers are working in the same company exactly at the same time. One of the company is a large Mediterranean hotel, a large resort, and they are working at the restaurant feeding about 1,000 people. One of them is the chef, and the other one is the waiter. And this example illustrates that some workers are working in Europe at relatively safe levels and may not necessarily need exhaustive mitigation and protection, but others need immediate support and protection. And if you asked me about 10 years ago, can we identify those workers who are in need of protection? And if we identify them, can we actually protect them effectively? I would tell you that maybe yes, maybe not. The literature on occupational heat stress about 10 years ago was very minimal. Throughout the world, there were about 90 studies in history. And out of those 90 studies, most of them were lab studies, which means that people were walking on a treadmill, and that was supposed to be simulating work. And out of those studies, about 5 were done in Europe. Something happened in 2015, and this has changed. The literature has nearly doubled since then. 2 things have changed. First, the climate change has made obviously the problem a lot more important. And second, the European Commission funded the Heat Shield project, which started in 2016 and has almost doubled the published literature since then. The Heat Shield project aimed to address the lack of knowledge in Europe, and from Europe being a follower, Europe now is a leader. About half of the published literature on occupational heat stress comes from European workers. And I think we did two innovations in this project. First, our aim was to move away from the lab. I am a lab rat and I love lab research, but it's important to move out and go to the workplace. So first, we did a number of field studies throughout Europe in many European countries. And the second was to take the validity and detail of the lab to the field. We were lucky that we had technology developments nowadays that can help us do that. So we used the pill that I showed you. We used miniaturized sensors and ability to analyze blood samples and urine samples at the workplace and have weather stations that are portable and valid enough to understand how the worker feels. But we also were able to do task analysis, motion analysis that they do in sports, and understand exactly what each worker is doing every second of their work shift and where they are. And be able to bind these two together, bind productivity and health data together, and understand how health impacts productivity and vice versa. If I had to summarize all our findings in terms of health in one slide, I would tell you that even in a single work shift in hot conditions, about 1 out of 3 workers will experience mild occupational heat strain. Heat strain means the impacts of heat stress on our body. And this mild heat strain can include symptoms like heat rash or heat syncope, which means fainting, or severe like heat exhaustion, heat stroke, electrolyte imbalances, and as my colleague Jason Glaser will talk to you later this morning, chronic kidney disease or acute kidney injury. But it doesn't only do that. Of course, it affects health, and this is number 1. But also, our brain tells us to slow down and take breaks. And as a result, this affects productivity. With the European Commission Joint Research Center, we try to estimate what is the impact of heat stress on the productivity in Europe. And we came up with an annual cost of about 830 billion euros per year that will increase to 4 trillion by 2060. The important thing here is not that. The important thing is that this is a large underestimation. And I'm an author of this study, and I'm telling you that this is wrong. The reason is because we used productivity estimates that were old. By the time we did this, we didn't have the new estimates from our project. The existing estimates at the time were showing that until temperature goes up beyond 28 degrees Celsius, productivity does not change. Beyond that, people start taking breaks. Well, later on, another model came up and said, well, probably it's from 25 degrees Celsius and up. In the Heat Shield project, a lab study was published by a group showing that probably it's much earlier than that, from 15 degrees and up. And then we did a large international study in the field with workers, with our time motion analysis, confirming that from 15 degrees Celsius and up, productivity is impacted. Do you know any place in Europe that doesn't have 15 degrees Celsius and up in the summer? No. The entire Europe is impacted in much more than what we have anticipated so far. What we can do, Jason Glaser later on will tell you a lot about this. It's simple and effective strategies: rest, shade, hydrate, wear appropriate clothing, and try to replace some of the very heavy labor with machinery. And we created an initial version of a personalized platform to protect workers. We called it the Heat Shield platform. Again, it was an initial version of what can be done in the future. We took meteorological data, analyzed them, and we provided companies and employers and workers with short-term and long-term guidance. So it's clear that we have the evidence, we have practices. Now it's time to move to legislation. Thank you very much for your attention.
Thank you very much, Andreas, for highlighting. Thank you for highlighting both the human threat and the human toll, as well as the economic costs associated with climate change. We're now moving on in our stories from the field over to Colin O'Hare. He's head of the climate change unit at the Department of Health in Ireland. And Colin, you'll talk to us about the tackling health adaptation challenges at the institutional level. Please.
Thanks very much. So I think we've already seen that what we're talking about is a cross-sectoral challenge, that the types of challenges we're facing in Europe are challenges we have faced before, but they are challenges that we will face more often going forward. And I suppose I will try to minimize the extent to which I repeat what's been said before me, but you can see from a European perspective that the impacts of climate change are starting to become very obvious. In an Irish context, we're looking at mainland Europe and seeing this is in the post coming to us. Projects like Cicero will go a long way towards helping us be warned in advance to what we can see. But I suppose what I really want to talk about is that when you look at how the health sector interacts with the climate adaptation challenge, you can look at it in two dimensions: the health sector looking inwards and the cross-sectoral piece where the health sector looks outwards. And you can also look at it in terms of the health sector acting reactively to extreme weather events or droughts or flooding, and you can look at it acting proactively to try to set ourselves up so that more extreme climate change will not impact on human health to the same extent. So in terms of the former, I suppose the health sector has faced challenges like air pollution, like dealing with heat waves, etc., before we knew climate was a thing. But what we've seen now is the types of challenges we're facing are growing more extreme, they're becoming more frequent. In an Irish context, what used to be called once-in-a-generation flooding events are now once a decade and are becoming more frequent again. The temperatures that we've seen across Europe, I mean, there's a chart and it's only going one direction, and that's the reality of what we're facing. So for a health sector to deal with it, there are certain aspects that are within their control. And what we've seen in Ireland is that you need strong policies, you need what within the health sector to raise awareness, develop strong guidance, work with your meteorological services or the other stakeholders to ensure that when you need to issue your guidance, issue your health warnings, that you're doing this in good time, you're doing it appropriate to the type of challenge you're facing. If you're trying to run a health system during a flood, you need planning ahead, emergency planning. But then when you come to the cross-sectoral piece, what I really see, this is where Ireland has done a body of work in recent years, and I think it's something that a lot of other countries are grappling with and are coming to terms with, but it's that cross-sectoral piece. So in an Irish context, if you look at building design, for example, we're doing a lot of work on retrofitting for obvious reasons for reducing the carbon footprint of our built environment, but you also need to anticipate if there are heat waves coming down the line, that these buildings are also adequately designed to ensure that the health of people inside them won't be impacted upon by heat waves. If you look at, we've touched on non-communicable diseases. If you look at how public spaces get designed. Are we putting in adequate shade? Are we putting in seating? Are we putting in access to water? These are things you can plan now, so the types of climate change that we're looking to have to tackle can be more adequately prepared for. And in that regard, I suppose this is where the cross-sectoral piece is probably the most important one. You need strong linkages between, for example, in Ireland, air quality is a policy that rests with our Environment Ministry. The strongest argument for air quality action is the health argument. So if you can equip both sides of the messaging with language that recognises this, tackling fuel emissions will improve, if you improve your active travel, that from a health reason, there's a very strong argument to be made for that. From an air quality point of view, there's a very strong argument to be made for that. If you're trying to bring about behavioural shift for actions that will reduce the carbon footprint of your cities, the argument for moving away from vehicles to public transport is a much stronger argument if it's made from a health perspective. You will see the impacts literally the next day if you get the reductions in air pollution brought about by bringing in public transport, for example. And I suppose what we've seen is the most important thing is that our health sector has it's a huge employer base. I think it's the biggest employer in Ireland. It's certainly the biggest landlord in Ireland. And the types of policies we need if we're going to equip our health sector for what's coming down the tracks are policies that rely heavily on a cross-sectoral understanding of why we need to think about certain challenges, why we need to look at how we do our business differently. And it's by working together with our finance ministry, with other stakeholders, if it's transport, with our environment ministry, that it's that cross-sectoral piece that is really where that's the sweet spot. If you're going to try and ensure both that your health sector can adapt its own buildings, that its own policies are reflected across the board, that your climate adaptation policies need to be put together with the other stakeholders who are relevant to that space. So your planning, your local government, like I said, your environment sector. It's all about that cross-sectoral piece. And if you have joined up messaging, your climate adaptation policies will be augmented by that. Your climate mitigation policies will be augmented by that. And ideally, what we'd look to see is when you look at a map in Europe of heat temperature in the summers of next year, 5 years, 10 years, we have a fair idea that that's going to go on a certain trajectory. And it's for us to try and minimize how far along that trajectory it goes, but that the impact that will have on human health will hopefully not go in that direction, but ideally will go in the opposite direction, to the extent that it's possible to actually tailor your living systems to take account of the health impacts of what those heat waves are going to do, what those floods are going to do, and what those droughts are going to do. So I suppose that's really the key that I wanted to bring here today, is that cross-sectoral piece. And I suppose for those of you working within your national systems, to reach out to your health sector and encourage your health sector to reach out to other stakeholders across government, because that is going to be the key. The climate change trajectory that we're on, we're at just over 1 degree at the moment. We're looking to minimize it at 1.5. That will bring a lot of changes. If you look at where we were at 0.5 degree, what did the world look like then? But it's going to be that cross-sectoral piece, is how you ensure that the health impacts, as we hopefully peak at 1.5, can be managed. So thanks very much. Thanks very much.
Thanks very much, Colin, on highlighting, again, the need to work together and to work across silos, and also highlighting how clean air is not only needed for health, but also very much for adaptation and for strengthening our resilience. The Anvil project has not only worked to gather the stories to bring forward the evidence on climate change and health adaptation, the Anvil project has also brought together recommendations for what is needed from the decision makers at various levels. And we now want to present you with the key recommendations coming out from the project, so that later on in our further conversations this morning, we can reflect on them, and we have excellent panelists and further speakers to bring this forward. So I would now like to invite Vincent Pagiva from the University of Botswana and Caroline Mutoni from the Aga Khan University in Kenya to present recommendations on accelerating climate change and health agenda in Africa through networking. And I would also like to say, in the interest of time, I would like to remind speakers to please keep on their time. And Miriam here is helping me. So when you see Miriam get up, you know that you have 1 minute left. Thank you very much. The floor is yours.
We have a presentation. Thank you. Oh, thanks. Good morning, everyone. So we are going to shift the conversation away from the EU into some of the things that we're doing in Africa. I'll start with one of my favorite quotes. If you want to walk fast, you walk alone. But if you want to walk far, we walk together. So we have a network in Africa called the CHANS, which is the Climate and Health Africa Network for Collaboration and Engagement. And I want to acknowledge the presence of some of the committee members in the room, Ganel, Shari, Julian, Matthew, and of course, my colleague Vincent here. And so we've been doing some work, and I'm going to unpack what the CHANS network is. And our biggest aim is to harnessing synergies between climate and health in Africa. And our objectives are, number one, to network and create synergies in East and Southern Africa. And then we also facilitate knowledge exchange, learning, and collaboration. We support and inform policy processes, and we also provide technical support for national and regional funding applications. Our key activities involve, we have meetings, we have webinars, we do workshops and conferences, we have these knowledge exchange sessions, and we also provide information to our members on matters on climate change and health in the continent. And our focal areas include heat and health, air pollution, climate-sensitive infectious diseases, and climate financing. However, it's not limited to that. We always welcome input from members in case there are some new areas they are working on. And as we speak, we have approximately 150 registrations from members. And these are spread across members from academic institutions, international organizations, non-governmental organizations. We have policymakers from health, from environment, from finance. We have people from the private sector and research organizations. I'm going to unpack the 4 objectives that I've spoken on and some of the activities we undertake within each objective. And so for the first objective, which is networking and creating synergies in East and Southern Africa, we work together with organizations such as WHO Afro. We work with AMREF. These are some of the organizations within the continent that are working on climate change and health. And we also contribute to meaningful discussions within the continent, such as we were part of the WHO COP27, and we were invited to the Health Pavilion to discuss issues on financing. We were also part of a gender conversation talking about the impacts of climate change on women's health, which Adelaide has also spoken on this morning. Some conversations on extreme heat in African cities, and also one of the biggest conferences in Africa called the AMREF Health Conference. We were also a part of that, where we contributed to the conversation on climate change and health. And the second one, which is facilitating knowledge exchange, we conduct these bi-monthly virtual deep dives where we invite the members to join us virtually. We give them an opportunity to disseminate some of the work that they are doing to other members so that we can learn from that. And we also have an opportunity to also disseminate the work that is also being done in NBEL to other members. I think we learn a lot when we listen to what other people are saying, and we question, oh, is this something that we can also do within our own institution or within our own countries? And we've had a very wide range of conversations that, as I've said, we focus on different things, and so we unpack that in these bi-monthly deep dives. And we also have annual in-person conferences. We've had 2 so far. The CHANS Network was started in 2021, so we had a conference in 2022 in Pretoria, in South Africa, and we also had another conference in Botswana this year. In these conferences, we now unpack for 2 days what is going on, what are the members doing. We listen to some of the research that is going on within the continent, and we listen to policymakers. We had a very good conversation with policymakers from different countries. What are some of the what are they undertaking within their countries to progress matters on climate change and health? And then the third one is we support and inform policy processes. In Botswana, we are part of the Declaration of Health and Environment Alliance, which is the HESA. We are contributing to that report. WHO is also progressing the COP26 health programs in 6 countries, and Botswana is one of them. We are part of that. And also, we were part of an in-depth discussion on African priorities and outcomes for health at COP28. I think one of us spoke about having a health day in COP28, and we want to make sure that Africa is not left behind and that we also provide our input. And so we've been part of some of these discussions that are going on within the continent to see how we can contribute to that. In Kenya, we sit within a technical working group in the Ministry of Health that works on climate change and health, some short-term goals. We help the ministry to come up with that. We are also part of a task force that is developing a 5-year Kenya climate change and health strategy. So this is a roadmap for Kenya on some of the activities that they're going to be undertaking within the next 5 years. And we are also contributing to the Ministry of Health, again, priorities on COP26 commitments. Through the NBEL project, you are able to train health workers on how to measure emissions within their facilities, and so they were equipped with some of these skills, and they are currently doing a baseline report to understand how the health facilities in Kenya are emitting, what their carbon emissions are, and that will help us come up with an action plan to see how we can mitigate that. And so again, the Chance Network was part of that. And then in South Africa, Matthew, who is also here, we were part of developing the National Heat Health Action Guidelines. These guidelines were actually sort of launched in one of our in-person meetings in 2022. And we also had one of the virtual webinars where the lead, the policymaker from South Africa, came to explain to the members how this came to be. And as I said, when other policymakers get to hear about what other countries are doing, they also start to question, is this something that, if this African country is doing this, it means we can also look at it, learn from them, and also implement it ourselves. And we are also part of a climate change and health policymakers workshop in Uganda, where they were trying to think of some priority areas that they can undertake within their own countries on matters of climate change and health. And as we speak, they're currently now doing their first vulnerability and adaptation assessment, from which we will help other people who want to do the same thing to learn from them. And then lastly, providing technical support for funding. We help members learn about some of the existing funding opportunities. In our in-person meetings, we bring in these funders, people, for example, from the Wellcome Trust, come and present on some of the funding opportunities on climate change and health, and members get to learn about it. We also connect the members to funding agencies, as I've said, during our in-person meetings. And in the just ended Africa Climate Summit, we were part of a regional consultation to inform investments to drive climate change and health research, policy, and advocacy capacity in Africa. And so some of the people who are investing in climate change and health wanted to understand, where can we keep this money, where can we take this money within the continent, and we were part of contributing to that discussion. I'm now going to invite my colleague Vincent, who will take us through some of the research work that we are doing. Thank you.
Thank you, Caroline, for such a wonderful presentation. I think, yeah, I can press on top. Okay. So, yeah, we also do some part of some research in Africa. And one of the research that we are doing in partnership with the London School of Hygiene and Tropical Medicine is this one on stakeholder mapping, where we actually wanted to understand how adaptation for health is addressed. We just looked at East and Southern part of Africa. And we do have quite a lot of work that we are doing, but I'm just going to give you just a synopsis of what we do. And as we are aware that, the impact of of climate change on health is evident, we really need to now understand how we adapt, or how health systems, what health systems are doing to adapt to these climate change effects. So we actually conducted a study in 12 countries. And then first of all, what we did was to review some policies that are there, policy documents. And then we realized that among those 12 countries, actually, all of them have actually developed national health adaptation, the national adaptation plans or strategies, and that was a plus. And also, all of them kind of recognized the importance of health, or that the health sector is almost vulnerable, which was a good thing as well. We also continued to look at the stakeholders or the actors that are involved in the climate change and health, what are their linkages, and also their needs. Our results also show that, only 4 countries actually had a specific national health adaptation plan. And also 5 countries have conducted the vulnerability and adaptive risk assessments. It's not shocking because, the VNA is kind of a prerequisite for a country to develop a specific health national adaptation plan. And also, it's something that is a gap that we realized in Africa. Most countries need capacity to be able to conduct VNAs so that they're able to have health-specific national adaptation plans. Yeah, so from the findings as well, we realized that also there is actually, like I said, an interest, which is high, and also, within with interest, also they have got the powers to kind of implement. So it's a commendable thing. Most of the Ministry of Health actually, you find that they are able to influence adaptation as well. I'll just move fast. And also, these are the key health adaptation priorities that we identified. The first one, you can see that most of the countries, 11 out of 12, they actually prioritize climate-sensitive disease control and prevention. They also kind of prioritized early warning systems, and also the integration of health surveillance systems in their plans. So, and this is where we are now. I don't know if you have a pointer. That's where we are at the integration of health surveillance systems. So we're conducting a gap analysis where we want to understand how national disease surveillance systems are responding to the climate change. It's an ongoing study. Yeah, so basically that was that. Yeah, sorry for time. And we actually also have identified some gaps as we're conducting or doing the chance network. And also we see this as an opportunity for us going forward, or for the future of chance. We have got issues like this low capacity and knowledge on climate change, which is also, I think, it's a global issue where it's difficult to bridge between the climate change language and also in health. And also, there's also growing evidence, but it's not documented, especially in Africa, where we really need to advocate for that. And also there's also absence of health-focused adaptation policies. We still have got issues where health is not discussed or is not really standing out in climate discussions. Right now in Kenya, we realized there was a declaration, but the health was not coming out clearly. So I don't know who's to blame, whether it's WHO, it's on us, or the ministries of health, but it's something that need to come out. So thank you so much. We didn't have much time, but this is some of the work that we are doing in Africa. We just had to rush through, yeah.
You can leave it there. Thank you very much for this presentation and highlighting again how important it is for the researchers, for the science to actually be engaged in conversation with policymakers. We have one more presentation before a well-deserved coffee break. So I'd like to invite Christine Aunan from the Cicero Center for International Climate Research to talk to us, and now move to Europe and talk to us about connecting climate change research, outcomes, and identified knowledge gaps from the Anvil project.
Thanks a lot. Let's see if, yeah, there we go. So I will speak briefly about some main outcomes, some observations, and some identified knowledge gaps that we suggest should be focused in future research. It's impossible to cover the full project and all its diverse elements, which you can get an indication of in this figure. This figure shows basically for these 12 different projects that are included under our umbrella, what are the climate hazards that are addressed? What are the vulnerability factors being looked at? What are the exposure determinants? And how are all these things working together to enhance the health risks or affect health risks? So it's also a list of the outcomes. I don't have time to go into the details, but you can look at our website. Also, I'd like to draw your attention to the policy notes in the corner. We have so far 4 finalized policy notes. There are several more in the pipeline, which will give you an indication of what has been going on in the projects and what are the identified knowledge gaps and policy recommendations. Very briefly, the outcome or the research going on in our projects and in other projects in the world related to climate change and health tells us that the scale and urgency of the health risks of climate change is critical. So this means that we really need to address this in research and policy. Sorry for my voice, it's not good today. So we strongly suggest that a coherent research agenda must emerge in the next few years and with adequate funding. That's extremely important, the funding question. When it comes to the different tasks ahead of us, it's huge. How do we adapt to climate change? And it's important. I mean, there are activities going on related to adaptation interventions. Things have been tried and started testing out in cities. So we strongly suggest that the activities that have already been implemented and for future implementation, we need to test their efficiency. I mean, we don't have unlimited resources, and the policies and actions we are taking needs to be cost-effective and then needs to be fair. So we would strongly suggest that policies address the costs and the benefits in terms of health burden avoided, in monetary terms if possible, and the equity considerations, how does these actions or interventions affect equity, and feasibility, are they acceptable by the population? So these are things, keywords for future research overall. An example is related to the interventions related to heat stress, which is one of the focus areas of NBEL. This table shows the output of a review of publications coming out, and it identified some heat health preventive interventions, whether it's general information, cooling, like air conditioners and cooling centers, where it's affected the workplace, education, healthcare, social, urban, a lot of different types of interventions. And the interest of this review was to look into how ongoing activities actually address the sensitivity of the most vulnerable groups. We do know quite a lot about who are the vulnerable groups. It's the usual suspects. It's older people, it's children, it's people with low socioeconomic status, people with chronic diseases, athletes, maybe not a typical group, but they are obviously exposed to hot temperatures as well and are vulnerable. Workers, pregnant women, and homeless. And the outcome of this review indicates that there's quite a lot of information or studies with many crosses. I will not go into the detail what it means, but you get an impression of who are kind of focused in a lot of the research. And it's a lot about workers and cooling, and it's about general information. And our report on this concludes that there's limited evaluation of heat health interventions in general, and it's a lack of evidence regarding effectiveness for the most vulnerable groups, the people most at risk. So we suggest that interventions need to address the socially deprived, the homeless, chronically ill, and mental illness groups. So there's a lot of vulnerable people in our cities and in our countries that have a hard time getting access to general information. So we need to be more active in interventions to target the different vulnerable groups in order to actually have an effect. Co-design has been mentioned. Adelaide showed in the film the importance of involving the people, the sample, the population, the people that are targeted in our research. And that's extremely important, and we are quite convinced that doing co-design, which means involving the people and the stakeholders from the very start of the project in all steps of the project, ensures that policies and interventions are feasible and acceptable. But we have to remember that doing this and building trust, it takes time. So we suggest that longer-term funding is strongly needed. It's very it takes a lot of work. You need to build personal relations with people to really get trust. So it's a long-term investment to try to do such kind of research. And of course, funding, we suggest funding should be focused on a project that with the potential to scale up to other areas than. Just very briefly, I'd like to mention the question related to wildfires. Wildfire pollution is increasing, and very briefly, and this figure shows how the air quality in Europe has improved. We have had a lot of efficient policies to reduce air pollution, and air quality in Europe is improved. This is the number of excess deaths, which has gone down from around 600,000 to around 300,000 today. On the other hand, the red line, its scale is different, it's small number still, but it's going in the wrong direction. So this means that it will be more difficult for us to reach air quality targets. It's not only in Europe, it's all over the world. Many places of the world struggle with wildfires. Such estimates are very different across different projects. There are large uncertainties still. So we need to improve modeling and forecast techniques to predict air pollution from wildfires. It's a really tricky thing. It's not only the fire weather, it's always a human, nearly almost a human behind starting a fire and how it proceeds. So there's a lot of work to do there. And there's also a question related to toxicity of air pollution particles. There are some studies indicating that wildfire particles is much more toxic than the general urban. But still, we don't know too much about it, and there is a strong need for future research. Of course, continuous development, implementation of comprehensive wildfire management strategies are important. These are things that have started, of course, but we need to have still a high focus on that and enhance it. Climate services and early warning systems are key tools in adaptation and increasing health risks. Climate services and early warning systems will look different depending on what's the health risk. Is it heat stress? Is it infectious diseases? But we have some general conclusions related to climate services. To be effective, climate services require high-resolution health and climate data. We need to know what is the situation locally, what are the health issues, no matter what is the different risks. And it needs funding, it needs training, and technological infrastructure, not the least, and support, including for doing surveillance. So we need technologies, software, apps, whatever, different alternatives to actually be able to carry out surveillance of the diseases, so that we can know what's in the pipeline, and link this to climate forecasts. We have noticed that there's often a lack of collaboration between health and national weather services, so we suggest this really needs to be strengthened. Partnerships with intended users of the services are needed to ensure that the services align with user needs and target high-risk groups. This, again, back to this co-creation, co-design approach. And very importantly, ensuring effective communication of what we find, including the use of multiple languages and culturally appropriate messaging. This is essential to ensure equitable access to climate services, and again, particularly for high-risk groups who may not read the policy briefs or whatever, our reports. Progress in early warning systems is piecemeal, that's our experience, and often not sustainable. They need coordination to exchange lessons learned. And again, back to this question about the benefits obtained from their use. We need to understand what are the benefits of alternative concrete interventions in order to create support and make it cost-effective and fair. Finally, we have also had interactions with stakeholders. We have had interviews and going through policy documents, etc. And this is just very briefly some lessons learned, and they are in line with what we find in the different parts of the project, so there are kind of no big surprises. we learned that there are major, people know about the health risks. They're quite aware of what might be in the pipeline, but there are major gaps in knowledge about how to adapt. What shall we do? What are the effective policies related to major climate hazards? And we find that there's still limited attention to health risks in adaptation policies, including in climate services. So there is a lot of focus on other things which are important, but the health risks attention is lagging behind. Adaptation requires cross-sectoral interaction, we have heard. Engagement with civil society is extremely important. Get acceptance, understand what are the needs, capacity building and training, also for health professionals. That has been also an important part of our project to advocate for that. As adaptation policies and measures are put in place, monitoring and evaluation is necessary. Again, back to this question about knowing what is effective. So that was my very brief summary. I'd like also to refer to this. We have a science conference in Stockholm, 11th and 12th of October, where we are gathering all the research projects in NBEL and a lot of other health and climate research going on in the world. It's a fantastic group of people who will present their work, and it's possible to take part online and of course welcome to come to Stockholm. So that's my final slide. Thank you.
Thank you very much, Kristin. We will come back to the recommendations and findings shared here after the well-deserved coffee break. So I invite you all to have a coffee. It's outside here, and we will come back to this room at 10:45 to continue the further exchange. Thank you.
Our planet is getting warmer. All around the world, human health is increasingly being impacted by global warming. Health and research communities experience a lack of awareness of the need for climate action for health protection. The World Health Organization has called climate change the greatest threat to human health in the 21st century. To help tackle this threat, the NBEL project, Enhancing Belmont Research Action to support EU policy-making on climate change and health, funded by the EU's Horizon 2020 programme, has been established. NBEL is bringing leading researchers and policymakers together globally to exchange the knowledge and evidence needed to tackle the health risks associated with climate change, with projects working on, for example, providing knowledge on the health risks from extreme temperatures and air pollution, and what adaptation strategies are needed to avoid death and disease. Assisting workers in hot environments to keep cool. Keeping expectant mothers safe through community support and education. Developing an early warning system for diarrheal diseases associated with extreme weather events. Climate-resilient health policy is especially important to protect vulnerable groups and at-risk populations. NBEL aims to provide knowledge to decision makers to ensure implementation of integrated and evidence-based policies in line with European and global goals to build a low-carbon, climate-resilient future.
We're living in a world that is getting hotter due to climate change. The last 10 years have been some of the hottest on record.
Πλήττονται περισσότερο οι κλάδοι οι οποίοι εργάζονται σε περιβάλλοντα με πολύ υψηλές θερμοκρασίες, αλλά κυρίως οι εργαζόμενοι στους εξωτερικούς χώρους. Περίπου το 23% των εργαζομένων αυτή τη στιγμή, κατά το 1/3 του χρόνου τους, εκτίθενται σε υψηλές θερμοκρασίες.
If you have so many workers working in the heat, and these workers will be getting more and more because you have more parts of the world that are getting hotter, the more likely is that the kidney disease in these regions will rise. Then the healthcare system needs to sustain all these. It's a vicious cycle that we need to cut, we need to stop and address this problem right now. We know these are issues in the developing world, but it is time to take action here in Europe.
Temperatures in Europe are the highest that they have ever been.
We have seen record-breaking temperatures.
In Spain, in Defto, after the heat wave hitting the country, rose to 360.
In Portugal and Spain, officials say it has killed at least 1,000 people so far.
It's still not clear exactly when this heat wave will end.
It opens the floodgates for that heat to surge up.
Britain is bracing for record-high temperatures.
So is it down to climate change? That's the big question. Climate scientists have been telling us for decades now.
And the toll of heat waves on human health is also expected to increase.
Όταν ο εργαζόμενος δουλεύει υπό συνθήκες θερμικής καταπώνησης, αυξάνει η αστάθειά του. Είναι πολύ πιο εύκολο να χτυπήσει. Είναι πολύ πιο εύκολο να χειριστεί λάθος ένα εργαλείο χειρός. Είναι πολύ πιο εύκολο να εμπλακεί σε ένα τροχαίο. Φαινόμενα τα οποία σίγουρα θα μπορούσαν να έχουν αποφευχθεί εάν υπήρχε η σχετική νομοθεσία και οι σχετικές οδηγίες, ο μπούσουλας πάνω στον οποίο οι ειδικοί γιατροί εργασίας θα δουλέψουν.
Θεωρώ ότι η επιστήμη μπορεί να δώσει τη λύση σε τέτοια ζητήματα όπως είναι της κλιματικής αλλαγής και της ανόδου της θερμοκρασίας. Θεωρώ ότι πρέπει να στρέψουμε την προσοχή μας στην επιστήμη και τα πορίσματα να τα κάνουμε δημόσια πολιτική.
During the Heat Shield project, we created a number of small pilot-based applications that can use climate data to support workers, provide some initial advice. We also created a platform that provides guidance for workers depending on where they're working, what type of job they're doing, and what the weather is going to be on the next days.
Είμαι ετών 45. Δουλειά μου είναι οικοδομικές εργασίες, συγκεκριμένα σε τοποθετήσεις πλακιδίων. Όταν πρώτο ξεκίνησα πριν 20 χρόνια, 25 σχεδόν, δεν θυμάμαι να είχαμε τόσο ψηλές θερμοκρασίες. Όταν ξέρουμε ότι θα έχει πάρα πολύ ζέστη, προσπαθούμε να ξεκινήσουμε όσο πιο γρήγορα γίνεται, δηλαδή οι πρωινές ώρες. Αυτό που μπορούμε να κάνουμε είναι να κάνουμε περισσότερα διαλύματα, γιατί κάποια στιγμή δεν αντέχεις.
At the FAME lab, what we've managed to do during the Heat Shield project is start initially with lab-based work and then go to the field, get a lot more data in real settings, in reality, and then see whether our simulations at the lab apply to the field, use the lab data to answer some of the questions we couldn't answer in the field, and vice versa.
jetzt zwar hier, aber man sieht es gar nicht. Machen die das dann noch, oder was? Ah. Ah, okay.
Heard about the broad picture and the many issues connected with climate and health adaptation, we now want to take a deeper dive on speaking specifically what is needed, with first talking about tackling the health impacts of climate change, which EU action is needed. And I'm pleased that we have a distinguished guest to shed light on this topic and on this question. And we'll be kicking off this exchange on the EU action with two short science presentations. So I'd like to hand over the floor to Alexandra Schneider from the Helmholtz Center in Munich, Germany, and she'll talk to us about the results of the Exhaustion project on heat and air pollution, a joint threat for health and a very much a current concern. Over to you.
Many thanks for the introduction. Here we are. So if you look globally at the number of deaths attributable to different risk factors, you easily can see that air pollution and non-optimal temperature range among the top 10 risk factors. So it's easy to understand that the environment is, of course, a major factor determining our health and our quality of life. And there have been several factors already identified which affect our health negatively or positively, but what's still missing is a comprehensive assessment of different environmental factors together impacting on our health. And this becomes more and more important because more and more people live in cities where many different factors actually impact our life. And on top of these different factors, we also have, of course, to tackle climate change. As I said, so far, heat effects have mostly been analyzed isolated, so just the temperature effects alone. But as you can see here, there are a lot of contextual and individual factors that come also into the game. And therefore, the project Exhaustion had as its objective to look at heat and air pollution at the same time. And so we chose an approach in 3 different levels. So in the first level, we only looked at cities. In the second level, we picked a few countries and looked at whole countries in an approach called small area approach, where we also looked at rural and urban areas. And in the third level, we chose a few prospective cohorts where we have a lot of individual information and investigated that as well. So what you see here is the city analysis, and of course what we found when we looked only at temperature, we found the usual exposure response function, which was U-shaped, so you have an increased risk on the cold side and on the hot side. But when we looked also at the interaction with air pollution, what we found is that if you look at heat effects on days with at the same time low air pollution, medium air pollution, and high air pollution, that on the days with high air pollution, actually the heat effects are much worse. And this was true for heart disease, but more surprisingly, it was even more pronounced when we looked at respiratory disease. So you can see here very clearly the increase from low, medium to high air pollution days, and these are the heat effects. As I said, we looked at it in 3 different levels, and so we were able to confirm these city results also in the second level, where we looked at these small areas in complete countries. So what you can see here in red is always the high air pollution days, in blue is the medium, and in the black the low air pollution days. And so you see this clear increase of heat effects via the different air pollution levels. But what we also found is that also other factors are very important. So it's not only air pollution that interacts with the heat effects, but also, for example, population density or the employment rate or the urbanization rate or the kind of green space access you have. And in this third level, where we looked at cohorts, we also were able to confirm this increase in heat risk over different air pollution levels. So we were able to confirm that more for fine particles compared to ozone, where it was less clear. So overall, I think we can take home that these atmospheric environmental exposures, of course, do not affect us in isolation. So instead, we are always exposed to a mix of environmental factors, and we have to look at this in a comprehensive way. Of course, that is very difficult because these environmental factors interact a lot with each other, and they interact also with individual factors, of course. Then last week, I think the European Parliament voted wisely for the alignment of new air pollution limit values according to the suggested WHO air quality guidelines. And this, of course, will bring more health. Also just because of lower air pollution levels, but of course also because lower air pollution helps mitigating and adapting to climate change. And so overall, I think an integrated environmental, climate, and health policy will have synergistic effects and generate health co-benefits of climate protection and climate adaptation measures. Many thanks.
Thank you very much, Alexandra, and thank you for sharing here this important evidence that unfortunately air pollution worsens the health-related impacts from heat, a message that is very important as indeed currently the European Union decision makers are considering the updating of the bloc's clean air standards. We're now moving on to a second science presentation, which is from Grace Turner. Great that you're already here. Grace is from the London School of Hygiene and Tropical Medicine in the UK as part of the Annual Project. And Grace, you'll speak to us about, question, a missed opportunity for adaptation, the role of COVID-19 recovery for climate change adaptation and health system resilience in Europe. Please.
Thank you so much. Perfect. Thank you so much for that introduction. And yeah, I'll be talking to you today about the COVID-19 recovery funds and more in general around implementation of climate and health adaptation and in terms of action in Europe. So for this overall project, it was sort of a combination of two things, and the overall aim was to explore the implementation of climate change and health adaptation. And to do this, we first reviewed the COVID-19 resilience and recovery plans to understand how they've been utilised as a potential opportunity for implementing action in terms of climate and health. So we reviewed these in 2022, so we understand obviously they're updating all the time. And in addition, we interviewed over 30 European decision makers in various different government levels, from city level to regional to national, and also at the international level, across 20 different countries and across different backgrounds. So we interviewed people in public health, environmental health, and also some who are adaptation leads. So just to cover, first of all, what we identified from reviewing the resilience and recovery plans. Well, it was sort of a requirement to obviously improve the resilience of the health system, and on average across all of the plans, around 9% of their expenditure was allocated towards improving the health system. On the left here is just sort of a illustration of all the different countries that we reviewed, and nearly almost all of them at least allocated between 30 and 49% of their expenditure to improving the health system. And this ranged from improving infrastructure, so hospital infrastructure, for example, to implementing new national health programs, but most largely was improving or implementing digitalisation of the health system. This was potentially around e-health, or as you can see on the left here in France, implementing a digital health platform and one-stop shop for healthcare. So we can understand that digitalisation is really important as we move forward, as it improves the resilience.
In addition to sort of what was a requirement for the resilience and recovery plans was to have an element that focused on the green transition. And as we reviewed these, the key climate themes came out were largely mitigation focused. And the 3 key themes were energy efficiency, sustainable mobility, and clean power. And whilst that's obviously really important, it's important about prevention, as we heard this morning. Only 6% of all plans actually allocated expenditure towards adaptation measures, and even less so were dedicated to health. So it shows that there's a potential opportunity in the future for implementing climate and health adaptation. In addition, as I said, we interviewed various different stakeholders and decision makers, particularly around identifying what they perceive as the barriers to implementing further action in terms of climate and health policy and action. And therefore, we kind of adapted or worked using the WHO Healthy Cities framework, because a large proportion of our interviewees were actually city-level decision makers. So it was really useful to hear what they perceived were the key barriers. And therefore, we came up with this sort of framework which prioritised, first of all, the digital transition and health surveillance, which we're already seeing in the recovery plans, which was great to see. In thinking about data and knowledge mobilisation, so that data and evidence sharing is really key, particularly at the local level, being able to access that data efficiently and effectively was important. As always, targeting vulnerable groups is essential. Thinking about governance and remit, so do I have the actual power to be able to implement in my city or at the national level, came up quite repeatedly. And then the bottom 2, which I think we've heard a lot about already today, but I'll just stress their importance, was the interdisciplinary collaboration, that being interdepartmental, sectoral, governmental. It came up time and time again as essential and a real call for it. And then, as always, more funding is necessary and the resource capacity and allocation. So just to finish up, the 4 key recommendations that we're putting forward to the Environment and Health Ministries at the city, local, regional and national and international levels is, first of all, monitoring. It's thinking about, we have these plans and it's really important that we effectively monitor and evaluate what those benefits are for climate change and health. Secondly, it's thinking about funding, which is key for allocating expenditure and resources for climate and health adaptation. Thirdly, which really came up and was really quite interesting for us, was training. So having a better alignment and training of public health professionals so they have a real understanding of climate and health, and therefore are able to uptake that and disseminate that within their departments. And then finally, thinking about intersectoral collaboration, it was a key barrier that came up, and we've heard it repeatedly today. But thinking about potential funds and grants that can be released that prioritise collaboration between departments and governments is essential. I will stop there because I don't have super long, but if you want to know more, it's the policy brief, is on the QR code, and it's in the corner there, but I'm happy to take questions in the break and the lunch. Thank you very much.
Thank you very much for your presentation, and especially for highlighting the key question of funding and financing, which is essential for then actually walking the talk, right? The talk that we always hear about protecting our health and strengthening resilience. But now is actually, it's time to stop with presentations and actually talk and have a conversation. And I'm pleased that we have distinguished guests on our panel. We're now going to have a panel, and I'd like to invite you all to come up here. So warm welcome to Alexandra Kazmierczak. She's from the European Environment Agency, and she coordinates the European Climate and Health Observatory and has particular interest in social inequalities in relation to exposure to climate change, health hazards, and social justice and adaptation responses. We also have Miriam Weber with us. Sorry. Miriam is a policy advisor on healthy urban living, environmental and public health research in Utrecht in the Netherlands, and also an advisory board member of the World Health Organization Healthy Cities Network and chair of the Environment and Health Working Group of the WHO Healthy Cities Network. Welcome. And last but not least, we have Luca Demalunere with us, Mobility and Clean Air Advisor for the Brussels Minister of Climate, Energy, Environment, Alain Marron. You are the climate policy expert, and you've previously been a member of the Belgian delegation with the UNFFC with a focus on climate finance. Wonderful. And this will also, so we'll start with an exchange here on the panel, but this will also be very much then the moment to bring in you as our dear participants into the conversation. So I'd like to start with a question to you. We've yeah, we've heard a lot already this morning in terms of the complexity of the issue, what's at stake and what's needed. And I wanted to ask you what stood out from you this morning? What resonates most with you? What do you find yourself thinking about? And over to you, Alexandra, first.
Okay, thank you very much, and thank you for the invitation. It's a pleasure to be here and hear all these wonderful outputs of this major research effort. It's truly inspiring. What really stood out for me this morning, it's maybe 5 things. First of all, how privileged are we to live in Europe? Having access to healthcare, having access to clean water, improving air quality. We are really in the position to be resilient to climate change when it comes to our health. The second thought is maybe in contrast to that, building on what Andreas was saying, no place in Europe is really immune to health impacts, be it on workers or be it more broadly. A couple of days ago, there was an article in The Guardian quoting the mayor of London, Sadiq Khan, who was responding to the very real threat of London having 45 degrees Celsius in real future, saying it's now time for those who are delaying action to wake up and smell the coffee, because this is happening now, it's now, and it's happening to us. And I think this message can be extended to many other climate impacts. Thirdly, the cross-sectoral approach. I think it's very important, and I think it's happening a lot at the higher levels of governance. I don't want to blow my own trumpet, but we have the European Climate and Health Observatory. It's also happening at the national level. Even just looking at Colin's job title, Head of Climate Unit at the Ministry of Health, it's also happening in other countries. We can see a similar structure in Germany, for example. But if we go down the governance levels, we can see that the adaptation agenda and the health agenda are very much separate. A few years ago, we looked at the state of implementation of adaptation at the subnational level, mainly local level at the European Environment Agency. And there was a very, very minor involvement of health departments or social care departments in adaptation actions. They remain very much led by the environment, spatial planning, and so on. So there is definitely a need for greater intervention at the integration at the local level. Fourthly, I fully support the notion of testing what works, what is efficient in terms of the costs, what is effective. Maybe what I would add to that is looking at the trade-offs of different solutions. I think that the nature-based solutions are very heavily promoted, and they are excellent. But we need to look at the unexpected outcomes, such as, for example, creating a habitat for invasive mosquitoes, or then raising risk of allergies, especially in cities. And fourthly, the need for intervention for the most vulnerable groups. Again, I fully support that, and maybe another group I would add to that is the migrants that are coming to Europe seeking better living conditions. We heard about the migrants dying in a forest fire in Greece. We know that the access to drinking water and the exposure to heat in camps, for example, for those migrants are something to act upon. So maybe I will shut up here and let the other colleagues speak as well.
Thank you. Thank you. Over to you.
Yes, difficult to add something to it, but I fully agree. I think it's about intersectoral work. It's breaking down the silos. We have been trying to break down silos at the local level as well. And so what stood out for me in addition is that what we often see in research projects, European projects, is that the main focus is on European level, national level, and yet the involvement and the voice of the cities is often missing. So co-designing, that was one of the words we heard in the presentations this morning as well, and the multi-level governance approach, I think is key. And from a city perspective, I'm working within the city of Utrecht. I'm working with a lot of healthy cities within the WHO Healthy Cities Network. Is what we often are trying to get to be on, to sit at the same table as where decisions are made, where policies are developed, where regulations are developed, and where funding is being allocated. And sometimes that's being at the table at the national level, but it's more often at the European level, and that's why it gets harder. So we're trying to get there. We're trying to involve research, so I'm really happy with this kind of research, and I'm looking forward to the European Union in further establishing, and like you were calling for, a research agenda on health and climate change and adaptation, and have this long-term funding, but involve the cities. Indeed, we need to learn what is effective, how do we address vulnerable groups. Those are the inhabitants of our cities, and cities have this equity perspective more and more. So invest your euro in the best way at a local level. We need the European level, the national governments, and we need research.
Thank you. Over to you, Luca.
Thank you. So I was writing during the presentation of this morning, but also during the discussion, the many good ideas that were presented today. There are too many to tell them all today, but I think there are 2 points that are very important. I think the first one is to say that, of course, today it is impossible to deny that climate change is happening. We've seen it this summer. We see it also in Brussels, and as I work for the Brussels Environment Minister, I can tell you that extreme events are also happening in the city. For example, a couple of weeks ago only, we lived our first ever heat wave in September. So it is becoming more and more visible, and it has an impact on both society and the environment. I think a very crucial element that you just said is the role that cities play in this crisis, because cities are at the center of the climate crisis. We are both very responsible for the emissions by the way we live, by the way we move, by the way we consume, by the way we eat. But we are also very impacted by the crisis and the heat waves and all these elements that were mentioned this morning. So, for example, in Brussels, just to give you an example, the temperature in the city center is 3 degrees higher than if you go just a bit further outside of the city. It's massive, especially when you have a heat wave. And we expect in Brussels, again, that the number of days with 30 degrees will quadruple by the end of the century if we don't do anything. So basically, for my minister, but also for all of us, it's crucial that we both act on reducing our emissions, but also on adapting, and also on taking into account the health impact that this climate crisis has, but also will have on cities. So I'm really happy to be here today to discuss about this with you, because I think it's not enough talked about at the moment, but it will have to be much more central in the coming months, years, and decades. But also one last element that I wanted to highlight is the element of climate justice and also of equity, because in Brussels, if you look at the map of where the heat is, and you if you look at where the poorest people live, it's exactly the same. And so I think that we should pay much more attention to that element, because there are some people that have much less means to adapt to these changes, and we should understand how they are impacted, because they have different jobs, they have different life patterns, they have much less means, and for a city like Brussels, it's very important to make sure that that we help them and that they are helped. So I think we want a just transition, but we should also want a just adaptation and a just resilience, right? So I have never talked about this with anyone in the EU, and I think we should start discussing this as well. I will stop there.
Thank you. Okay, indeed, a lot of points raised. So let's go into unpacking, or diving deeper into some of them. And I'd like to start with a question on working together across sectors and across silos. And that was also a question that we received on Slido. So please do continue sharing your questions, because we heard a lot this morning that this is needed. We heard from the European Commission, how this has taken place. But from your perspective, I'm looking especially at you, Miriam and Luca, here on the city. From the city perspective, can you tell us how this worked, how it actually moved from being, from there being an awareness that we need to work together, say the health department, the climate department, the urban planning department, and what do you tangibly have in your cities? And because I'm also always very much a fan of sharing good practice as an inspiration, and I think there's an incredible lot of good practice happening across European cities. So yeah, Miriam, do you want to start?
To start
Yep.
with that. I think what we were lucky in Utrecht in is that we have quite a long period of quite liberal, the green left local politicians. So around 10 to 12 years ago, our local government really urged us as professionals to work more intersectorally. As they said, we want to be a city where people can live, work, recreate, grow up in a healthy manner. So we introduced this, what we call health in all policies approach, which now over the years has moved to health equity in all policies approach. So this means in practice that we had to rediscover how to do our daily work in order to address health. So a spatial planner needed to consider health issues. Same goes for mobility planning. We from the health sector needed to learn the language our colleagues from the spatial planning department were speaking. And a very great supportive way in doing so was that we just arranged interdisciplinary teams working within the city hall, but within the neighborhoods as well, where all these different disciplines are coming together on a weekly basis, discussing everything that is happening in that neighborhood and bringing in their own expertise and learning to discuss and share what's the most important or how can we align. So it's the political commitment or even order to work interdisciplinary. It's about really facilitating this interaction throughout your daily work. And it's, of course, then establishing your long-term visions and ambitions. So in Utrecht, we have several interdisciplinary health equity targeted programs, being it our public health policy plan, which is about work and income as well, about social security, it's about the living environment. But we have a spatial planning strategy for 2040, which talks about health and health inequalities. We have a climate adaptation plan. We're joining in the 100 climate neutral and smart cities. So it's throughout your work in setting the frames and the ambitions, the politicians setting the agenda and even thriving that agenda. And then we as professionals working cross-sectoral, breaking out of our silos and involving the citizens. I think that's some of the key topics we learned. And of course, it's sharing, it's learning, and it's constantly trying and see what went wrong and what went good.
Mm-hmm. Thank you. And how has highlighting the health threat or health in general, how has that helped this breaking down of the silence?
Yeah. I think this awareness at political level started when our colleagues, we do have epidemiologists working within our public health department. They were able to show this picture like we have from Brussels, where we see the difference in health outcomes. And then the notion of that we have two neighboring neighborhoods, so adjacent to each other, where we see 12 years of a difference in good perceived health outcomes. That was the trigger. And by constantly collecting health data, reporting on health outcomes, bringing that into new policies, whether it's about the play areas or even this strategy on spatial planning for 2040, that makes that we increased awareness about health outcomes in various ways, about health and well-being. So there's a strong input of data, which we collect ourselves. And we always have more the qualitative assessment as well. So we go out, we talk with professionals throughout the city, we talk with the citizens to give them a voice, which makes the message from the health department much stronger than without the data, without the stories and the narratives.
Thank you. Yes, how is this in Brussels, Luca, with the cross-sectoral?
More or less the same, I would say. I mean, we try to include health issues more and more in the environmental topics that we address in Brussels. I would say one of the good practices is the fact that my minister is both Minister for Health and for Environment, so he's very much aware and he discusses a bit with everyone, so he's very much aware of the links that exist between these two fields. And so via this mean, we could ask our administration to work much more on health indicator, to collect much more data, to include that much more in our policy making. I could give you a lot of examples, but I think one of them is also linked to the fact that we should involve citizens more. But for example, we had a project called Curieusonnaire that some of you may know. And basically the Curieusonnaire project, the idea of it was to allow 3,000 households, organizations and celebrities to measure air quality in their street. And so the idea was to say, you know, when I walk into the street, I want to know what I breathe. For example, I know that here we breathe 35 microgram NO2 per cubic meter in the street. Should we talk about it, knowing that it's 3 times more than the WHO recommendations? And so it's projects like that we try to implement, because it both collects data, because we work with universities that can double check the data and make sure that it's solid, but it also starts a discussion with the citizens about the measures that we have to take. Because very often when you plant a tree and that you remove a car park, a parking space, they are angry because they don't understand. I mean, a tree is okay, but very often it could be a bike, and there it gets nasty. But if you can first make them measure air pollution, then they want to know what does it mean for my kids, 35 microgram. Is it dangerous? And then you can tell them, yeah, you know, maybe we should change the way the city works, and there you can put a bike rack because they understand why, and maybe they will start biking because you can also tell them that it's better for health. So I think there are many ways in which we can work together, the two worlds that we were talking about, to make a city much more sustainable. And there are so many co-benefits that it's very easy to find them.
Thank you. Alexandra, as part of your work in the Climate and Health Observatory, you've analyzed member states' action. So we're now moving from the city perspective to the member states. What can you tell us there about the working together between the different fields?
Yes, indeed. A couple of years ago, we looked at the national adaptation strategies of countries across Europe and national health strategies to see how these two types of documents tackle climate change impacts on health. The main findings were that it's actually the national adaptation strategies that tend to cover it in more extent, and the national health strategies are either building on the recommendations of the national adaptation strategies or somehow maybe lagging behind. Another interesting observation was that there was a very much focus on physical impacts of climate change, and that the mental health was not yet fully recognized in many of those strategies. So that sort of relates to what Philippe Roux was saying about the Commission's communication on mental health. Another interesting finding was also that the most frequently planned interventions were those linked to monitoring and surveillance, and we know that it's very important. Awareness raising, training, and more research. But what we saw is that these actions are very much in the sort of sphere of capacity building, and there were many fewer concrete actions actually planned in those strategies. So that shows that we are still at the beginning of the journey when it comes to the planning of the solutions. We can't say much about which of these actions were actually implemented, because the study was looking more at the actions planned. And that's where we actually see the major need to speed up the implementation of the actions. Yes.
Thank you. Okay, now it's time for you've now listened enough to what has been said. Now it's time for your comments and questions. I'd like to invite the participants here in the room to share any questions, any thoughts that you have. Don't be shy. Anyone? Yes, Alessandra. And if you could first say who you are, please, even for you, because, for our audience.
Yes,
Thank you.
I'm Alexandra Schneider from Helmholtz, Munich. I just wanted to add a bit on the German adaptation strategy, which is currently under revision. And so we were actually asked to help with the revision, and they asked who are the vulnerable groups, so which social factors actually determine who is more exposed to heat, who is more susceptible to heat. And I thought first it's easy, like you said, it's the usual suspect, but it's actually not true. So it's actually a big overlap of different groups and risk factors, and it's a big, so you need to consider all intersections, because you could be like, for example, an old person, but you have a lot of other beneficial aspects. So you have a good economic situation, you have a good neighborhood, you have flexibility in your time schedule, and then this actually offsets all your risk. So you really need to consider all these things. And it's actually, when we were at the end of our literature review, we found out the most important thing is time flexibility. So in every age group, in every disease group, if you are able to, like, for example, say, I don't have to pick up my child at 1 p.m. at the kindergarten or at school, and I can put that later, or I can do home office and I don't have to walk to my work during heat, then it's offsetting a lot of risk factors, actually. So I just wanted to share that.
Interesting. Thank you very much. Any further? Luca, you want to? Yeah, please respond.
Very quick. Do you hear me? Yes. It's not really answering to your question or to your remark, but it's just an idea I had when you were talking. One of the elements that I was struck about here is the fact that we talk a lot about hard science. Huh? We have facts, a number of people dying, degrees increasing and stuff like that. But in Brussels, for example, one of the challenges that we meet is how can we have the people with us? How can we communicate these risks to the people that are affected? Because the most vulnerable people, they don't speak French, they don't speak Dutch, and they don't speak English in Brussels. So, and often they don't read the press. So when you pay a lot of money to put a billboard in French and in Dutch, you don't reach them. Or when you go and you talk to them in French, they don't get it. So I would be really interested to have like good practices about how can we change, because we have to change a lot of how we work in the society. How can we communicate, explain, and get the people together towards this? And so maybe that's a point that I wanted to make is what can the EU do, and the scientific community is work on also on other stuff than just hard facts. Kind of.
Let's come to the EU in a minute, but I wanted to actually add on to what you said, because Miriam, you mentioned very prominently the equity aspect, and that's also part when we speak about vulnerabilities. We definitely have to speak also about people facing health inequalities. So do you have some tangible example of your plan? What does that involve? And then adding, linking to what Luca you said, how do we actually reach these various groups at risk?
I have two sides of answers, suggestions on that. One is from the experience we got from the COVID-19. There we had, of course, similar difficulties in reaching out to particular groups within our communities about the lockdown, the measurements, how to behave, how to go for the vaccination. We had everything about all the myths you could come up with were, of course, shared during the COVID pandemic. And what we experienced there is what we call using key figures, key persons. So that is, for example, the imam working in particular neighborhoods where we have a high percentage of Muslim inhabitants. Involving those people that have a kind of a position within their neighborhood, speaks the language, understands the culture, the values, the ways how to approach people or their communities, was key in both living according to the lockdown rules and in the vaccination strategy. So we had quite a high percentage of vaccination coverage due to the use of these kind of key figures. And this group is still in place. So they are constantly involved in what we do in policy planning and implementation. So we will use them in several ways. The other thing is, and I was talking with one of the representatives of the climate NGO in the Netherlands last week, and she said we need a new narrative, and it's a narrative about maybe the vulnerability, but particularly about loneliness. Because we know that people that that are lonely experience far more problems than maybe just the heat stress. And this is something we need to take care of in our communities. We see the increase in mental health issues in relation to loneliness. We see the aging population. So this might be a new pandemic, and using loneliness as a kind of a narrative or a kind of a joint ambition to address, we can talk about the heat topic as well. So two ways of answering or suggestions on your question.
Thank you. Alexandra, you mentioned the need to consider mental health much more prominently. So can you, and I saw you nodding now a couple of times, can you add from your perspective?
I was just reflecting on my previous life as a researcher and also working with disadvantaged communities in one of the British cities. And indeed, the community leaders, the spiritual leaders were the key to actually unlock the potential of those communities. On mental health, yeah, not sure what to add. It's definitely a big problem, both in terms of the extreme weather events affecting people's health, but also the climate anxiety, especially among the young generation, about what will my future look like if it's so uncertain and if it's so plagued by disasters and uncertainty about being able to live a fulfilling life. So indeed, that's something that needs to be tackled, but what message can we actually give to the young people?
Mm-hmm. Thank you. Well, that we will continue to, that there's a continued need for action, definitely. Colin, yes, please. Yeah.
Hello. Yes, it feels slightly silly to say I'm still Colin and I'm still the climate lead in Ireland's Health Ministry. It also feels slightly silly to ask my question because you've kind of answered it since I got the microphone. But I suppose what I was going to say was I was quite struck by the Brussels experience of giving out the 3,000 air quality monitoring tools. And we've done something similar in Ireland where we looked to bring in a no parking range near a primary school. And by enabling the school to measure the air quality before and after, if you give people ownership of the data, the impact that has on behavioural shift or on policy development it's very interesting to see where it goes. And it kind of ties into where the conversation is going on that stakeholder engagement piece. And I suppose what I'm wondering is whether in Utrecht or, examining policies across Europe, if there are strong examples of stakeholder engagement that works, if I can put it that way. Thanks.
I think there are, throughout Europe, there are examples at local level about stakeholder engagement. And, participation is one of the 6 Ps within the Healthy Cities Network. So particularly healthy cities are looking into that. But looking into Utrecht, I think a very nice example where we learned a lot about stakeholder engagement was the first climate adaptation plan, or the renewable energy plan, I must say it was. It was written by the citizens. So they were invited to step forward, and they have been working for 3 Saturdays to draft that plan. So that has not been written by my colleagues from the environmental department, but it has been written by inhabitants. And we are building on that. So in the smaller sense, so involving children in assessing their neighborhoods on play areas, and that's the input for us in our new play area policy plan, and the funding to create more play areas, to improve certain play areas, or have the skate and the graffiti places for the older ones. Up to now, for example, in the tendering of new buildings and for new neighborhoods, having really a citizen panel that is involved in the tendering procedure from the beginning. What should be in there? How do we want to have the city look and feel? and then on the decision making, who is going to win the tender to build that new apartment building, for example. So there are quite a lot of examples, and one of the things we often share when we go international is our really nice waterway around the old medieval center, where the local government in the 1980s and 1990s decided to turn it into a highway because everyone wanted to go to the new shopping mall by car. That was a new ways of living, and that was thriving as a community. And then by the end of the 1990s, more and more citizens started to bring in that they wanted to have the cars out and have the waterway back in. So we have been working for more than 10 years, bringing back the water, and now we have the circular old medieval moat back, which is a park, and you see so many people walking in there, and that was because we had this stakeholder engagement, because we had really citizens urging the politicians to make these changes in the city. And yeah, you see the reward or the effect of that. So it's really small up to the really big ones. And of course, we're still learning a lot.
Luca.
Yeah.
I just wanted to very quickly react to what you said, because there's maybe some good practices that I could share with you on that particular topic. I think, so basically, to have 3,000 people participate, it's big. You have to invest a lot of efforts, but also if you do it a bit like you would do every project, then you will only have the same people always answering the project, the highly educated people living in the north of Brussels and stuff like that, in the south of Brussels. But so we invested a lot of efforts to have people in the street go talk to regular people, to the night shop, to the club, the sports club, to and things like that. And I think it worked. So the only thing I could say is you have to invest efforts to have everyone. And also, what I also wanted to say is that it's an air quality project, but we could do an adaptation project. We could measure the heat island effect with people in the city center and then just say, okay, let's draw together the street that we would like to have, because the street next door has a tree and it's cool. So I think it could happen in a lot of other areas.
Thank you. Alexandra.
Just wanted to say on good practices that one of the aims of the European Climate and Health Observatory is to make sure that the examples of good practices of what works are widely known. So here is my plea to everyone in the room and everyone online. If you have any good examples of actions that led to then improvement of health under the changing climate that help to prevent the climate impacts, then I would be really, really interested in having those and making sure that others can learn from that through the knowledge hub that we have in place. Thank you.
Thank you. So I have a final question for our panelists, since unfortunately our time is coming to a close. And since we did entitle this panel, which EU action is needed? We've now heard a lot about the really important and exciting things that are taking place at city level or at member state level. So what is needed from the EU? Is something needed from the EU, or is, we just continue with what you're doing at city level? Luca, you started talking about...
I don't know what exactly is needed from the EU. A lot of things is expected from the EU, I think. So you know that adaptation is a very important element and a very important issue that we want to bring forward during the Belgian presidency in the coming months. I don't have a lot to say about what we will do, because it's still being discussed internally within Belgium. We want to see a bit what are the good practices, what we could do. But what I can tell you is that your ideas are welcome. So if you have ideas, just bring them to us, not to me, because, but to my colleagues, to my colleagues of the administration and working on that. But I think that what we should do and what the EU should do is start from the evidence. We had a very good panel of studies and of scientific that explained us what is happening. And we should ask ourselves, what additional action should the EU undertake to adapt to climate change and to make sure that health and environment are better interlinked? And it could be new laws, it could be new standards, it could be new ways to help cities access finance, because that is a very important element. It could be, could it be that we could better integrate health in every sector, because we will not have every year a health and environment minister or a one world, one health commissioner that will solve everything. So we have to make sure that there are ways to work together. So, I mean, I don't know the practical details, but I would be really happy to have good ideas of how we could do and start the discussion, because I think we have this discussion about what the EU could do, what additional new actions could be done, but also what the next Commission will have to do. And so we want to create a discussion around these two big topics. Huh?
Thank you, Miriam.
You're lucky that you will have the presidency, but next week in Valencia, the Spanish Ministry of Health will organize a full-day symposium about health and climate and integration. So maybe some take-home messages that you can borrow for the next half year. I think we have all said it before. I think we should look for the right narratives, and those start at EU level, and it's about integrated stories. So indeed, intersectoral work, stressing where we need to go, because that's the umbrella where a lot of legislation, policies at European level, at national level, and thus as local level will be developed. And another call would indeed be for funding. What I see in Utrecht is that we have now 2 colleagues working on heat stress, but only for a few hours a week, because we don't have funding to really address that. And we had a slight change in national program for 4 years. We'll see how many municipalities can use that, particularly on heat and health and climate topics. So funding to be used for what's effective, where indeed, from an equity perspective, should we invest in, and how to scale up some best practices you are collecting at different cities, because, you know, Ireland is different from what we see in Greece. It's different from Utrecht. So scaling up best practices, evidence-based practices, and supported by European funding would be crucial.
Mm-hmm. Thank you. Alexandra.
Well, at the European Climate and Health Observatory, we will do our best to support the efforts of the countries and the cities and then stakeholders across climate change, adaptation, public health, health sector, and the other sectors, with the knowledge that we are collating and developing in partnership with the organizations in the observatory. So both through the collection of the best practice examples, but also through tracking as much as we can the climate change impacts on health and the solutions that are being implemented through actions aimed at increasing climate literacy in the healthcare and public health sector by trying to enable the integration of climate change adaptation into the health strategies and vice versa. So please do tell us what else we can do, how we can do things differently to make sure that the observatory is being used and supports you. Thanks.
Wonderful, thank you. Thank you very much to all our panelists here. And I would now like to hand over to Fleur Bonasso, who will do with us a short interactive exercise. It's also about our health in this room here, right? And then we're continuing in the program.
Thank you so much, Anna. So hello, everyone. My name is Fleur Bonasso. I work for the Red Cross Red Crescent Climate Center. I'm very pleased to be moderating the second part of this day. Also stepping in for Sonja van Rensen, who unfortunately cannot be here today. So I'll start with a little exercise in which I would like to ask you to have a brief conversation with someone sitting next to you or behind you or in front of you about your passion with regards to health and climate agenda. So it's just a very short conversation that you can have, talk about what interests you most or what excites you most about, you know, taking action forward in relation to health and climate. Self-organized, please. if I can talk. I think this is a sign they immediately kicked off talking. So I think they also want to be actively involved. They have been listening more. Are you happy so far?
I mean, there are things we can evaluate afterwards, but the main thing is that people are here and we are in dialogue with them, and I think we are able to show
density of information provision is really high, which is really makes it really interesting. This is what I want. I'll give them 2 more minutes because we started a bit late. Yeah. Introduce you properly. I think it's funny, they immediately went off. I've never seen that before. The room was full of attention and immediately they kicked off talking.
They needed
yeah, because the active listening is, you can only take so much. So I think it was time for a bit of interaction. I'll go until 53, so I'm a little bit behind. And then I'll go ask for some reflections from the group, and then I'll give you the floor. I know Francesca gave it to me. She said, I brought one for you, Elise, and I said, oh, not for me. And then I could have this. All right, clap once if you hear me. Clap twice if you hear me. Clap 3 times if you hear me. Clap 4 times if you hear me. I'm sorry to break up your conversations. I know that this is always nice to have some time to really find out who's doing what. I would like to give the floor very quickly to those who would like to say just a very brief highlight of the interaction that you had. So what did you hear about the passions in the room, or tell your own passion? So I'll just give the floor to somebody who likes to. There is a microphone, but maybe if you speak loud, we can also hear it. Is there somebody who would like to say why you're here and what's your passion in relation to health and climate? I'll take the mic. So, any nice insights that you heard? People looking away from me. No passion. Is there no passion in the room? Passion on health and climate? Any? Yeah, Kirsten, thank you.
So in our group, there were two overlapping passions. The monitoring, I mean, to get people involved, giving them devices so they can measure whether it's noise or heat or air pollution, so that they can start to get interested. So there were two examples of this, getting people, getting interested in environmental epidemiology, and it was in the schools, was it? So, so to make people understand what this is about. It's not something theoretical, it's something affecting the local environment.
Excellent, thank you for sharing that. One more, who wants to share? Yeah, Sandra.
Thank you, Fleur. So we were looking at the perspective of the governments, from local government, national government, and a bit of a global perspective from our side. So it was very inspiring to hear the cities. It was really, really interesting to hear Utrecht, of course, and Brussels, and what they are trying to do. And we were talking about integration, how it is really not integrated climate in general with health. And I'm not a health expert, and I think we were a bit sharing the same. We really need to work and talk together and co-create, and then give a space to the civil society and to the people, no, to the communities. So it was really that perspective that I took, and I think it was just by coincidence that the three of us with government perspective were together. Thank you.
Thank you for sharing. All right, this brings us to the second part of the day, and we'll have again a panel discussion, but we'll start with 3 short science presentations today. And this whole second part will really focus on what is needed to address the health impacts of the climate crisis, looking forward, what is needed now. So I'll start with the very first science presentation of my very own colleague, Tilly Alkaina, on climate finance gaps for health. Tilly Alkaina is the Senior Technical Advisor of the Red Cross Climate Center. So, Tilly, please, come on up.
Hopefully my presentation can come up. Next one. Yes. So I'm very pleased to be able to share the findings from a study that we conducted, which was looking into climate finance, something that I've heard come up quite a few times throughout this morning. And specifically in climate finance, we were looking at a decade's worth of adaptation finance and how it has been targeted to the health sector. And so what I'm going to run through very quickly is who has been providing this finance, how much has ever been provided across this decade from 2009 to 2019, and where has it been going. So of interest to everyone here, I am sure, the EU institutions have in fact provided most of the adaptation finance that has gone to the health sector between 2009 and 2019. So they provided 26.1% of the total volume of funding, which should hopefully be pretty interesting. You can also see, for example, specific countries and where they sort of rank within this. So Germany 5th, Norway 7th, Sweden 8th. And also many of these countries are also putting money into the Green Climate Fund. But nonetheless, interesting that the EU institutions come out as top. The total number of projects that they funded was 12, and the average per project was 31.1 million. So not a huge amount when we're talking in millions. How much has gone to the health sector? So in a decade's worth of financing, around 29 billion has gone to climate adaptation finance. And of that, according to these publicly available databases that we were using to try and understand the financial flows, only 1.4 billion has gone to anything that are health related. So these were projects that were tagged as related to health within the databases that we looked at, which was the OECD creditor reporting system, Rio Marked, and then the Climate Funds updates databases. So this is both bilateral and multilateral financing. So only about 4.9% is going to health-related activities. When we took a deeper dive into that, we found that actually only about 0.2% of funding, of all adaptation funding across this decade, was going to any projects that are specifically having some kind of health objective. And that might be Health National Adaptation Plan, workforce training, health information systems, or early warning systems. Where is the money going? So this graph in blue, this map up in blue at the top shows the climate vulnerability of countries, and you can see that largely in sub-Saharan Africa, the climate vulnerability is the highest, marked by the darkest blue, and also in South Asia. At the bottom, hopefully you can see it a little bit, is this health adaptation finance that I'm talking about. And you can see that the darkest green, meaning the highest amount of financing, it is occurring also in sub-Saharan Africa, but it doesn't fully align up with where climate vulnerability is highest. And then if we look at this biggest map, darkest purple means highest health vulnerability, and the yellow circles means the amount of climate adaptation finance going to the health sector. Larger circles, more finance; smaller circles, less finance. You can see that whilst many of the larger circles are thankfully in the countries with high health vulnerability, they're also not consistently across the countries with the highest health vulnerability, and that in fact, across a lot of sub-Saharan Africa, you have some pretty small circles of climate finance. And when we look at the biggest circle is effectively around between 47.6 to 75.3 million in a decade. That is really not very much money. So overall, climate finance is not really aligned to where there is the highest climate vulnerability nor the highest health vulnerability when it is going specific to the health sector. So some of the recommendations, this is one of our studies from the policy brief, so you can read many more of the recommendations that we have there. But ultimately, we absolutely need more adaptation finance, which is fulfilling and going well beyond obligations under the UNFCCC, and much, much more needs to be targeting the health sector. Advocacy, research, and actions, they really need to prioritize the countries in which we can see that there is the highest climate vulnerability and the highest health vulnerability. And funding should absolutely be channeled to support the implementation of further health national adaptation plans, and also a lot of engagement with adaptation leads within the Ministry of Health, as this is often still siloed. Thank you very, very much, and you can find the policy brief at the back and then also on that QR code. Thank you.
Thank you, Tilly. Quite sobering, but clear and sharp recommendations. Next is, in line, a presentation on climate change and inequality, and how can adaptation protect the most vulnerable, from Sari Kovacs. So she's an associate professor of the London School of Hygiene and Tropical Medicine. And she leads stakeholder engagement in NBEL, and she also co-leads the policy work that is being done, and is part of the CHAMNA project on climate, heat, maternal and neonatal health in Africa. Welcome.
Thank you very much. Very happy to be here. So what I'm going to talk about really is some of the findings from several of the Belmont-funded research projects that were within NBEL, and that we're trying to translate those results, as well as some of the results of the stakeholder engagement we've been doing that previously mentioned by Vincent and others. So we all know, and Tilly's just shown that in terms of the highest, most vulnerable populations to climate change, they really are the populations within Africa and within South Asia. But what I'm going to talk about is the within population vulnerability. And we really need to develop our adaptation. I mean, we are at an early stage of developing adaptation policies, but what we're really missing now is to making sure that those adaptation measures are effective and also protecting the most vulnerable. So we don't have a lot of information on adaptation, but we know that some of them are not protecting the most vulnerable. And it's clearly that when you put in a policy and you don't take inequalities into account, you will increase those inequalities because the rich and the better educated are going to be able to adapt and the poorer populations are not going to be able to adapt, so that you're just going to end up with a worse, potentially a worse situation. So I'm going to be talking about impacts of climate risks and climate change on children. I'm also going to be talking about gender. Adelaide's also has previously shown that lovely video showing how heat affects maternal health and also how the women are differentially affected because they're having to work in the heat and how some of those gender issues do need to be addressed in the intervention that was developed. And then obviously impacts on children now will have implications for future generations as those children grow older. So this is we have a project called Award APR where they've looked at the impacts of temperature and rainfall on diarrheal disease. So the burden of diarrheal disease is very sensitive to rainfall extremes and higher temperatures, and children are the most affected. The vast burden of climate-related impacts is in children under 5, both in terms of mortality and morbidity. And we know that they're actually more affected by the climate effects, if you see. They're kind of differentially higher risk as well. And this project has looked at diarrheal cases in a range of countries in South Asia, and they've also looked at ENSO. So when there's an ENSO, children are also disproportionately affected. And we need to both look at sort of outbreaks of diarrheal disease, but also the sporadic cases as well. So the prevention measures here are really what has been discussed many times previously. It's working with other sectors, working with wash, sanitation, housing, built environment. Those are the measures that you need, as well as hygiene interventions, to address this problem. Now, this is some work that we did within the Chumna project as well. And this is also true for infectious diseases. So we looked at heat-related mortality in children under 5 in Africa. And apologies for the graph, but essentially we looked at the effect of climate, but we also disaggregated, you know, the population is growing. Africa is experiencing quite high rates of population growth and urbanization as well, which have huge implications on the health burdens. And so that will increase the risk, but child mortality is improving through health and non-health interventions, so we took that into account as well. But essentially the warning experience so far has offset that benefit in mortality reductions. So this is an impact that we don't see. So climate change is already affecting health. And when we do a lot of this modelling, the health future assumptions that we use are very optimistic, and essentially they're going to be wrong, because as we head towards a kind of hotter 3-degree world, those health trends are going to stop declining, essentially. So we'll be undermining the gains that we've already made. So we also looked at newborns. This is results from the Chumna project again. And so there's very strong evidence that high temperatures increase the risk of preterm birth. So already preterm births or babies born too soon are highly vulnerable to a whole range of health conditions, and lifelong health conditions. So the climate's already affected their sort of their life course and damaged their chances. But we looked as well at newborns and how, also shown in the video, how heat basically makes infant care very difficult. And so there's 2 points I want to make here. One is that we're quite at the limits of data. So we are doing a lot of epidemiological studies, but we really don't have a good measures of a lot of health outcomes, okay? So beyond mortality, we need to be looking at morbidity, and for looking at studies of temperature, we need quite frequent measures and better surveillance effectively. So investment in data systems is key to addressing a lot of these climate risks and also understanding the benefit. You can't evaluate a lot of interventions unless you have good data. But it also stresses the importance of the qualitative research, so the field work that Adelaide led, talking to mothers, talking to health workers, so that we understand the mechanisms by which heat affects health as well. But we did do one quantitative study on breastfeeding behaviour because there'd been in Burkina Faso, a previous study had invested in talking to mothers on a very frequent basis about their daily activities, and so we were able to show that at higher temperatures, breastfeeding time is decreased. So we've looked at adaptation policies in Africa, and Vincent's already mentioned how we spoke to various stakeholders as well. And, you know, adaptation planning is at early stages, and this is true for Europe as well. And as I've said, we need to consider, to have an effective adaptation plan, you need to actively have evidence-based strategies to address inequalities. And this is a big opportunity because many countries in Africa are now revising and updating and drafting their plans, you know, like Kenya and Botswana. So for us to be able to get the evidence that they need to then design in these strategies within their plans is a big opportunity for us. And as you can see, so there is sort of some mention or some consideration of inequalities, but there's no specific measures and there's very little in terms of objectives or specific targets, you know, really robust policy levers to ensure effective adaptation. But gender is a priority. So climate and gender is firmly on a lot of countries' radars, but that's really not aligned with the health data. So health is missing from a lot of these adaptation strategies, and we need to do a lot better to work across sectors. But this is what a lot of the stakeholders have said about in terms of priority. So these are what we know works in terms of addressing inequalities. Many people have mentioned engagement, participation, talking to the right groups, and making sure you're talking to them, whether you're developing the intervention locally or more broadly when you're developing policies. Social protection measures. We know extreme events, occupational heat illness push people into poverty. We need those social protection measures as well, particularly where there's a lack of universal health care, you know, out-of-pocket payments. And then early warning for all is a key part as well, but it's not the only part. And early warning, I know there's a big investment in early warning at the moment, but again, the health sector's not really engaging sufficiently in that conversation. So just to finish up, so we've got very good evidence that climate change is already undermining our global health strategies. So there's a key role for the health sector to engage and develop evidence-based strategies for intervention. But it's not just the health sector. We need health in all policies, and we need capacity strengthening, particularly around environmental public health, in order for health people to engage in other sectors and adaptation in other sectors to protect health. Thanks.
Thank you, Sarah. Sorry. Very, very insightful. I know that there is not time for questions and we're going pretty quickly, but I am happy to take one question if there is a very urgent question for Sari. Good. Otherwise, you can find her during lunch. Now, the third, last but not least, we have a presentation from Jason Glazer, who is the founder and CEO of La Isla Network, and he is really championing the occupational heat research, and he is dedicated to end heat-related illness. He will tell us about workers and heat stress in occupational settings and implications for the policy response.
Oops, which way going? There we go. Not least in size, anyway. So it's before lunch, so I'm going to try to keep this pretty tight for all of us and get moving. If you want to find out more about the work, there's a wonderful film that's screening this afternoon from Arte. We're featured heavily in it because apparently I convinced Mikkel we know what we're talking about. So he's featured that from Arte. There's also an excellent policy brief right there in the middle that we did with Shari and her team that I think gets across a lot of the issues that we both are going to talk about. And I really encourage you to attend the film screening because the discussion should be pretty robust and you'll see what this actually means for people on the ground. So I'm going to talk to you about findings from a center of excellence that we've developed in Nicaragua, looking at the intersection of high heat, heavy labor, and inadequate historically labor protections. And the Center of Excellence we were able to develop in Nicaragua, which now exceeds protections that exist, to our knowledge, anywhere in Europe or the USA for agricultural workers. Keep in mind that what I'm going over also discusses threats and outcomes that are affecting people in construction, especially those returning home from the GCC to Nepal and India who worked on the World Cup and other projects, and also in Southeast Asia and parts of Africa. So, oh man, I'm having trouble there. So heat stress, it's important to think about, like if we go on a beach vacation in Nicaragua, we're going to be okay. We're surfing, we're drinking Mai Tais, we're enjoying ourselves in a high heat environment. However, when you combine that high heat with internal heat from your muscular load, your core temperature goes up and a whole host of issues start to set in. You get leaky gut that can start systematic inflammatory response syndrome, which can lead to an exertional heat stroke. That can lead to greater health risk, increased accidents in general as you become disoriented. You lead with early mortality as well. And you can see the different aspects of heat stress right over here. And I think Andreas did a wonderful job early of characterizing those. But the really key issue here is it leads to early mortality at much higher levels than we understood before, and also reduced productivity. So not intervening on these issues in developing economies is really iatrogenic, meaning that you might invest in a company through a development bank like the DEG or Proparco, who says we're going to fund X sectors, sugar or mining or construction. But if these interventions aren't concerned in the development of that project, you're actually going to be causing more harm than good. And that's actually exactly what we saw in the sugar sector when the IFC, the International Finance Corporation, was investing heavily in that sector, but not investing in occupational health. And what we saw was startling. You see what is now the leading cause of death among men 18 to 45, or the second leading cause of death in the countries of Central America that have more gunplay and gun violence. But in areas like Nicaragua, where that's much lower, it is the leading cause of death, kidney disease. You've had so many acute kidney injuries from heat stroke that you end up with kidney failure, and this is 18 to 45. So what's happening then? You're removing people from their prime earning age. We've talked a lot about mental health today. What's that doing to communities when people are widowed? And now you see widowers as women enter the workforce to replace the men that are gone. And you are also driving child labor. So by not considering these occupational safety health interventions, when we do development projects, we're actually probably reducing our impact and our hope for development when we make those investments. So our team has really looked at that through an integrated approach. I mean, on the occupational side, our hygiene, physiology, epidemiology team, I'm an epidemiologist, work with physiologists such as Andreas. We really look at assessing what's going on the work site, on the ground, boots on the ground, train people in those skill sets, map out where the gaps are to close those gaps. And then we assist in implementation. I think Shari mentioned this, a lot of people have mentioned this. The team from Chalmers in general, I think, excels at this. The time you need, and Kristen managed to really get this across as well, the time it takes to really focus on implementation and pushing those relationships so that from upper management to the worker, to the community, and the supervisors all understand what's really required to do this is key. So you can't just go, here's your implementation of your intervention design, good luck. Like, you really have to develop these implementation assistance systems. And we do that through an integrated approach we call PrEP. So prevention is fairly obvious, and I'll get to what that actually entails. And it's not rocket science, but it really requires that implementation, assistance, and science. Resilience we also do as we're doing the interventions on the occupational setting to protect workers from the heat stress. We look at what this means for the company. We look at what it means for the community and the health systems. Are these interventions actually improving resilience on the community level? Then we look at efficiency, because we've all heard these biases that if people take breaks, if they protect themselves, we're going to have lower efficiency. Absolutely not true. You'll see the data, but it's a core tenet in getting things across. Can you increase efficiency or at least maintain it with these interventions? And can you provide a return on investment for the employers who are taking this on? And then protection is taking the data that emerges from these community and occupational level studies and business level studies, and then informing policy. And we call that protection. So, the main intervention we developed is not rocket science. It's about rest, shade, hydration, and sanitation. But a lot of these things are forgotten. Like if you have increased women working in these at-risk jobs and you're asking them to drink more water and hydrate, you better have sanitation in the fields when they're working with men. It's often overlooked. These basic fundamental things are overlooked consistently. And the rest I would even put ahead of hydration because it's all about maintaining core temperatures. And these good practices that we've developed, like I said, aren't rocket scientists and their design, but understanding physiologically what's happening to the body has relevance right here in Europe. Because these realities in Nicaragua, where you have high heat and high core temperatures, are now happening right in the EU, and in fact last week, and I'll get to that near the end of the presentation. But if you think about 3 things you want to do with interventions, you want to reduce harm, you want to increase productivity, and you want to provide an ROI for those who are investing in it, both on the public sector and the private sector. So if you look at 38 degrees core temperature, which Andreas talked a lot about is kind of like your threshold for what's acceptable, you can see a site 1 with no workplace improvements. This is actually El Salvador. They spend the majority of their day over 38 degrees. They're in danger. At the end of the harvest, they have 21% of their workforce with kidney injury. Now in population levels-wise, 30% of the men in these populations have kidney disease. 10% of them are end-stage renal disease. This is devastating health systems. This is devastating economies. Now, if you look at what we've developed in Nicaragua through PrEP and EU funding and US funding through the Belmont Forum, you keep that below 38 degrees, you work about half the workday, and what do you see? You see 1% kidney injury, and you're like, Jason, they're working half the day. How can this possibly work? Well, I'll tell you, the physiologists, we're seeing that what happens to your productivity when you slog it out, it just goes down, 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 down. And what happens when you're able to take breaks, how many of you do circuit training or physical training at all? Where you do HIIT training, you hit it really hard, you take a break? Can you imagine doing the HIIT training for like 45 minutes straight instead of having those intervals? It's not any different. These guys run at the same level as far as workload as a Navy SEAL, as an ultramarathon runner. They're doing it every day, 6 to 7 days a week, 6 months straight. So they really require that recovery. You reduce the harm. We've provided a 20% ROI. We can go into more of that in discussions at lunch and during the film about how you achieve the return on investment. And then this is where it gets really surprising. So we have 10 years of data on productivity from the sugar mill that we're working with. This is their data. This is how they make business decisions. This isn't us going, look at what we've achieved here. This is what they rely on. So when they started, you could see they worked about 8 hours active day, the sugarcane cutters. And they started introducing their own interventions from 2016 to 2018 and lowered it to about 4.5 active hours a day, down to 4.2 when we start doing these improvements through PrEP. What do you see on the right? You see, or on the left there, on the blue, you see the per person tons per hour cut, because it's all piece rate, which is a perverse incentive, which requires its own presentation. But the productivity actually goes up by hour and by day. They're now cutting as much per day as they were 10 years ago, working half the time. And that place where they had no intervention was cutting about a ton per day less, about 10% less, not more. So if you think about expansion and prioritization, we know there's going to be a massive impact on productivity. Globally, that's been discussed, I think, heavily today. It's really essential, though, that we expand these programs to more places in the global south, not just sugarcane, salt flats, informal sector, and as well as construction. We see a lot of this in the construction sector as well, and gold mining in particular. In fact, some of the best early data on this is buried in old studies from South Africa and the gold mining sector. This is not a new problem. It's a problem that we're seeing more of with greater surveillance and greater understanding of these markets. This, I think, is kind of basic stuff, but it's really underfunded. Surveillance, identification, prevalence studies, who's affected, where do they work, so you can develop the interventions. Develop the research for people who are already sick, so you have interventions for them on the health system. And then communication about telling the story. We've done a great job working with Arte, working with Ed Cashy from National Geographic to tell this story, and it's something that nobody used to care about. But if you type in Jason Glazer, The Guardian, you'll see dozens of articles. And that's a huge shift. You know, it's not about Jason Glazer, The Guardian. It's about impact beyond the impact factor. Are the masses understanding these risks, and are they coming home? You know, but let's bring it home. Like, how do we take a leading program in Central America and bring it home to make it relevant in Europe and the US? We know Europe is in danger. We know it's warming faster. We know we're going to have massive productivity losses. Last week, there are actually 6 deaths in France from heat stroke. Cutting grapes. I'll tell you, cutting grapes is not the same as cutting sugarcane. It's not as tough of a job, but it's tough enough. And when you're not acclimatized like these workers are in Nicaragua or Guatemala or El Salvador, what happens is the heat wave becomes extremely fatal. You can see the attitudes of the wine producer syndicates. There's this worker blaming. Like they say, we pay them by piece rate. It's not our fault, they're working too hard. I mean, this is a very perverse approach that we really have a lot of education to do back home, both in the US and EU. And we've got to change the structures that people work in, not put the onus on the individual, and try to make sure that we understand what's happening, what the impact is on our migrant workers and the people that do the jobs most of us would not want to do. So this is really apropos that this happened. It's tragic, but just last week, 2 in Beaujolais and 4 in Champagne. I'll just conclude with what I really think we want to push for is a center of excellence based on what we've done in Nicaragua, based on what we're developing in Nepal. We also have systems being developed in Mexico, Guatemala, El Salvador, and Honduras. I think it's time to bring it home. We're working with Turner Construction in the United States of America and Liberty Mutual Insurance. I think we should develop what we're doing here in Europe, and you certainly don't need to rely on the gringo. You can work with KfW, who's funded our work. Andreas' team at FameLab is absolutely incredible. London School of Hygiene and Tropical Medicine, I'm an alum. I'm a huge fan of the team that is here. We work with CNV International, Birmingham, and the Swedes have been disproportionately incredible in occupational health, maybe to a big surprise. So we worked with Karolinska, Gothenburg, and Lund have been instrumental in our work, and we're very loyal to them. But if we can find one wine producer, for instance, one construction company, and build these systems, I think that's a way forward for Europe. So you have a living lab in Europe to learn from and adapt to the realities here. So thanks a lot. If you want to get in touch with me, go right ahead. But you can get in touch with Andreas as well. He's part of our network. If you're wondering what LISA Network or Foundation is, it's just basically a collective of the people you saw in that list working collectively on this issue. So Andreas is quite happy to help here on the European side, and we can talk at lunch or after the film screening. Thank you.
Thank you, Jason. Thank you for underscoring the insane risks of workers in heat. We will move to the panel discussion, and we have a great lineup here for the second panel as well. Just to reiterate, 2 o'clock, the film screening that Jason flagged. Don't miss it. It's going to be very interesting. So, sorry, back to the panel. I would love to introduce the panelists to you and invite them to the stage. And I'll start with Chiara Martinelli. She's the director of the Climate Action Network, CAN. We all know the famous network. It's a leading NGO coalition with over 190 members, member organizations, and 38 European countries representing 1,500 NGOs. So it's a huge network, and it's hugely important in the negotiation process. Then, secondly, Mette Petersen. I'd like to invite my colleague, the director of the Red Cross EU office here in Brussels, representing the humanitarian network of the International Federation of Red Cross and Red Crescent, and of course also 27 national societies here in the EU region. And Britain, yeah, British Red Cross, Norway, and Iceland. Then last, Hans Staubel, welcome. The DG International Partnership of the European Commission, welcome. He is the acting director for Africa and covering all the EU policies related to Africa, I understood. Welcome very much. We will kick off. I'll come and sit next to you. There's some water if you like. We will kick off the panel with Chiara, and it would be great to hear from you a little bit of the key takeaways that you've taken from the discussion so far today.
Thank you. Thank you for being here. And first of all, thank you because it has been an incredible learning morning for me. So thank you for all your inputs. So I will try to be super brief. I know we are running once out of time. I think I have 4 words as takeaways from this morning. The first being inaction, second mitigation, third adaptation, and fourth is money. So I would like just briefly to explain what I mean. I think I heard a lot about all of us having a right to health and a healthy environment. But also I think we heard a lot how much climate inaction is basically failing all of us in Europe and beyond Europe. So I think I heard about speaking about a right to health, to health and a healthier environment, but I think we should continue to stress that in the context also of all our work at different levels in calling for a right to health for everyone. The second point, mitigation, I think we, again, I really enjoyed and appreciated that several inputs were stressing the urgency and also keeping stressing the urgency of reducing emissions. And I think this is, we don't have basically another way out of that. So I think, again, like very important to make that part of the picture. And I think also we heard that through a couple of examples and some best practice, how mitigation solutions like rollout of renewables, energy efficiency, insulating homes, the last presentation as well, restoring nature, are also not looking into, of course, are mitigation solutions in terms of reducing emissions, but are also solutions that are healthy, positive solutions. So I think this is important to stress. Third, the adaptation, I think we spoke a lot about adaptation, so I'm not repeating myself, but it's definitely the big elephant in the room, the big priority that I see for us in the next months to focus on, and I'm sure we will come back on this in the panel. And then fourth is money. I think really my big takeaway is like the pressure that we need to feel on our shoulders to keep what we sometimes we say with the volunteers and activists, like shifting the trillions to where basically we are creating all this problem and climate change towards investing in adaptation, in mitigation, and in the support of the most vulnerable communities.
Excellent. That's great. Thank you for those recap and the highlights of today. Now, Hans, could you provide us with some introductory words on the health and climate nexus?
I can try at least, and one of the problems in my job is I often have to speak to colleagues who know 10 times more about the issue than I do. But I think, and I have unfortunately not been able to be here all morning, but just listening in the last half hour, I think it is clear the nexus in this area is very direct. Obviously, climate change have direct impacts in terms of climate disasters, heat, drought, etc. We just heard about the impact on workers. But we are also very well aware of the fact that climate change is having its hardest impact on the most vulnerable populations, which have a number of both indirect and direct consequences, income, resilience, education. The more vulnerable people are becoming, the less capacity they have to withstand illnesses, etc. So that link is very direct. It's also clear that climate change is putting the health systems, in my case in sub-Saharan Africa, under severe pressure. So we see that as a very real and present danger. So these are some of the issues, and I think they have been represented here this morning, at least in the small part that I could take part in.
Thank you. Thank you. And then Mette, over to you from your perspective. What are the most urgent climate and health priorities to support vulnerable groups? And are those being met? From the discussions, it's clear it's not.
No, thank you, and thank you for having me here today in this panel. First of all, I think that one of the things we need to look at in terms of needs is to break down the silos. Yeah? We're talking about health, climate change, so it's as much as we need to work in the nexus, we also really need to work in a coordinated way. When you go into a community and you ask what their needs are, they're not going to say, I need this in health and I need this in climate. Yeah? So it's very important that you have that when you go in and look at risk. Then also so the first point that I want to make is that, of course, what is important is that the most vulnerable are reached. We saw in the previous presentations, both in terms of where the money is going, in terms of where are the biggest risks, and we see there's not a correlation between that, firstly. And then secondly, this research and this event here is really important to put focus on some of the real vulnerabilities. We saw it with the migrant workers, we saw it with the women, the pregnant women and children. So really looking at reaching the most vulnerable, this is really important. And linked to that is also important to engage with them and to hear them, yeah? Because if you don't listen to what they are, if you don't engage and listen to what are their capacities, what are their situations, you are not really able to respond to their needs. So my first point is that we really need to reach the most vulnerable, we need to hear them, and we need to engage with them. And as you also said, Hans, one of the challenges is that the least vulnerable are the ones that are the least able to adapt to the climate changes. The second thing is, and we also heard that very much, and it's also in the research when you're looking at it, is that we really need to ensure equitable access to quality healthcare. We see it it's also highlighted on the charts there. We saw with COVID how there is not an equitable access to healthcare. And as you also mentioned, Hans, you talked about the need to support health systems, and we very much from the Red Cross and Red Crescent support this, but we really want to put emphasis also on ensuring a strong and resilient community health system, so that you're able to really go the last mile out to the communities. And we've heard, and this is also very much highlighted throughout, the importance of also focusing on mental health. This is we're focusing a lot on physical health, but the mental health part is also really important, and also social protection to make sure that you have an equitable access. And the last thing I wanted to raise was around that vulnerable people face disasters, several disasters. Unfortunately, you can't just say one disaster. They're facing many different. We had the COVID, then you had heat waves, then you had droughts, then you had floods. So people are facing different disasters, and we need to look at that. They cascade into many different difficulties that they're facing. So we need to have this sort of multi-hazard, multi-disaster approach. And for that, we need to, again, I think my voice is here from the communities. We need to have resilient communities able to respond to these compounded disasters.
Excellent, thank you. Hans, I will go back to you for a second. The Africa Climate Summit is just behind us. And what I understood was that the Africa Union Declaration that came out of that only showed just one reference to health. So very little focus and attention to the health, or to the health needs that we've seen here today. But do you think climate change and health are taken into account in the EU-Africa strategy? And
yes and no. We are working very actively on climate, and I can come back to the climate summit. We are working very actively on health following the EU-Africa summit in February 2022 and the announcement of the EU-Africa investment package, as we called it. But also now in the context of the Global Gateway investment package, we are investing heavily in both health and also in climate. But we are not doing it as an integrated science, if I could call it like that. We obviously have colleagues who knows about these things. Whenever we develop programs in the various areas, there will always be a link, but it's not a discipline that we have developed that I cannot pretend. Obviously, a lot of the work we are doing in the respective areas. Health, we are working very actively with the African partners on the pandemic response, vaccine production, reinforcement of the African system for public health, CDC, and whatever it's called, African Union, we work with them. We have a number of regional, we have a number of national programs in the area of health. On climate, we are obviously very focused on supporting adaptation, mitigation. We launched in the context of the Africa Summit the 1 billion Team Europe initiative on climate resilience, working with 5-6 of our member states, mobilizing, as I said, 1 billion. We have a number of pillars, but it's not integrated at this stage. That I cannot sit here and claim. That would be dishonest. We obviously hope. And the last thing I want to say, whatever we try to do, and for Sub-Saharan Africa, we have in this financial perspective 29 billion euro in grant money. So it is a substantial amount of money we are managing. The red thread through all of we are doing is supporting the green transition. So it's not just sufficient to look at what are you doing in climate, what are you doing in health. You also need to look at what are we doing on supporting the energy transition in Africa, etc. What are we doing on digital? How do we ensure digital is sustainable and climate adapted? Transport, how can we support the move away from roads to rail to waterways, electric public transport? These are things we are working on. But I could continue for a long time, but colleagues are getting hungry.
Thank you. I think that's very good to hear and honest reflections about the level of integration of health and adaptation. And I think it also came out of the discussions. We see that it's hugely challenging to have that fully integrated as a common approach. So great to hear. Mette, I'm going back to you for a second. What do you think the EU could do to support the African countries or low and middle income countries to respond to and to prepare for the health impacts of climate change?
Yes, so I'm going to continue with what I said earlier. There are two things that I really want to stress. The first thing is, as I said, the community supporting the local actors. This is really important. Without supporting the local actors, they're the ones that are out there providing the services. They're the ones out there bringing the health messages, the climate change messages. So they're the ones that are making the changes in the field that are needed. We need to have all the changes at a higher level, but without investing and strengthening the local actor and the frontline responder, you will not be able to have the impact that you're looking for. So really the first one is invest in local capacity and community-based workers and volunteers. The second one is, and we've talked about adaptation, but I would like to stress the anticipation. So we know that there's a lot of disasters that are happening, and a lot of disasters that are happening that are predictable. Yeah, we have a lot of agreement with methodology. I can never pronounce it.
Met offices.
Met office, that's easier. Met offices, where systems are set up. So climate services, early warning, all these things are being set up. But if you don't have action when there is a warning, and that is again going down to the local actors, then you can shout as much from Nairobi or Kinshasa if the action doesn't trickle down, if you don't have the system set up, if you don't have the locals to react, you will not be able to have that real response to reduce the impact. So the second one is really the thing that we are calling for is to strengthen, of course, adaptation, but really also putting focus on anticipatory action. And then to underpin these things, of course, it is really important, as I said, that you need to have at all government level the strengthens of policies and strategies which effectively manage these rising health risks. So we need to have those. We also need to have very important legal frameworks, legal frameworks in place that allows for anticipatory action. So disaster laws and various things like that that can underpin the work that we do. And then, as you said, financing is very key. And I saw on the panel over there, I wrote it down because it's so health-focused climate finance for local adaptation. I think this is a very good message. So to say that we need the financing not to be siloed, and I hear you, Hans, it's a challenge because there still is this sort of silo approach, but we really need to look at what are the risks and do a proper risk, health and climate risk assessment, and based on that, then looking at how do we best invest. And that is, of course, for us, we are, as the Red Cross, we are very much keen on supporting the local actor, but also in terms of if you're going to build a hospital, where is that hospital best placed? Where is that hospital then built in a place where it's not going to be destroyed by the next flood? So these risk assessments are, both climate and health, are really, really very key. So that's what we're calling for.
Excellent. So risk screening for all the European investments I hear here. Then Chiara, over to you. I think, in the run-up to COP28, and we have the Climate Ambition Summit in front of, we're in 2 days. Can you tell us a little bit from your perspective, what is really needed? What can the European Union also do in order to push the health and climate agenda on these big tops, on these big summits?
Yes, so I can maybe bridge on what I just heard. I think it's very, I really appreciated also the feedback from you, that it's really a challenge to have more this holistic and integrated approach. And I think this is somehow interesting that we are facing, when we speak about adaptation, this is the same debate we are facing within Europe and in our support as Europe towards the most vulnerable countries. So I think this is really need to be part of our debate in the way forward on how to not only break the silos, as you said, but really having this integration across sectors. That I think also links to the point that you raised, that I think we will never hear enough about shifting towards a locally led initiatives. I think there have been some efforts also from the European Union with a couple of initiatives also around the EU-Africa strategy, but I think there is so much still to be done in that regard that we needed to put forward. And this is linking me to answer to your question. I mean, tomorrow we are going to listen to all the supposed to be climate leaders, our political leaders in New York, and we are preparing towards COP28. And I think we also have the luxury of having almost now every week scientific evidence and a UN Secretary General that is stressing and overstressing and never tired to stress the emergency we are in. So I think in a way, it's a great base for us, for all our messages. And I think when I think about the EU, of course, the calls, the wishes is a big list when you go to an international climate summit such as the COP. But I think that it's the moment to really show leadership for the EU when it comes to adaptation. And when I say that, I have two main expectations to see the difference of the EU approach towards this summit is on increased adaptation finance. So, and we already mentioned that and why, and also to really be a bridger when it comes to making sure that we operationalize and resource the loss and damage fund. I guess everybody here in the room knows what's loss and damage and what's the loss and damage fund. I think we managed to get this agreement also because of the last-minute support of the European Union during COP27. So I think now we cannot give a signal that now we will need 3-4 years to get it operational and financed. I think at COP28 we need to make sure that is there. And I think what is interesting in the discussion, and I think we can make use of it in our political work, is not only the loss and damage fund is not only a discussion of filling a pot. But it's also really about how do we do that. So it's about integration, it's about the criteria for vulnerability, it's about the prioritization, and it's about prevention of risks that are happening now and not in the future.
Great. I'm very glad you mentioned also the loss and damage agenda there. Any additions from the other panelists maybe on this and on plans for negotiations?
No, maybe just briefly from me. I think you mentioned the Africa Climate Summit that took place some 2 weeks ago, and I know my president was very, very pleased with the outcome, and I think it's first time there was actually a positive dimension between Africa and us on these aspects, where clearly President Ruto wanted a positive agenda. I think the fact that there, for the first time, seemed to be recognition on targets for sustainable energy, renewable energy is very important because it has been one of the tricky issues in our discussion with Africa. The fact that we, from our high horse, insist no use of fossil fuels. They logically say we have a lot of resources, we would like to use them. How can we reconcile some of these issues? And the whole discussion on the climate finance we see as very positive. The clear commitment that we now need to take some concrete steps in that area, be it green bonds, be it increased support for the loss and damages fund, etc. So there is hope, and of course, if Africa could speak more coherently with one voice, I think it would be in everybody's interest. Yeah. So that's my last comment.
Yeah. I will end with a bit of a cheeky question, Hans, for you, if you allow me. So the planning for Horizon 2025 and 2027 might be ongoing already for the Europe program. And of course, I think many people here in the room would also be very interested if that would open up opportunities for a second NBEL2 application for continuation of the work that we're doing.
I think I'm clearly the wrong person to ask.
Yeah.
Horizon 30, it's not us, it's DDRTD. We obviously work very, very closely with them. So that...
Then we'll follow up with them.
You have to follow up with them, yes. We are obviously in the context of the midterm review. I mean, DIGI, the funding period 21 to 27, looking at where are we, and in particularly on the climate finance. This is something that we are looking very closely into. You might recall that our president some years ago announced 4 billion extra for climate. Nobody really understood what this was, but of course the implication is it does mean, and of course we have to deliver on what our president wants us to deliver, that 43% of the money we mobilize for sub-Saharan Africa has to meet the DAC criteria for climate financing, which means it's not just the 30% we have in the INDIGI regulation, but we have this internal political declaration that we want to reach 43%, and that is really, for us, that is a very significant step away from the past where we would have been closer to 20-25%. So we are basically under instruction to double our climate financing.
Excellent. I just look at the audience for a second, and maybe the online audience. Are there any questions for this panel? It's also lunchtime, I do realize, but I think that may... I do see. Jason.
I can just use my big voice, you know? All right? Never mind. All right. So I thought it was really great that you talked about these things being a human right. And Andres and I actually had the opportunity to speak to UNHCR for the special session because the US, because of really bad behavior in Texas recently on heat stress and repealing rights that were actually put in place on the state level. So we have a chance to speak. They welcomed us to come in with a note. What should we say, you know, in that space, in your mind? Like, what do you want to get across in that session? Because you brought it up. We've got the opportunity to go. We can be your mouthpiece.
Thank you.
Yeah.
I mean, I think it is, so according to me, and maybe it's also where I operate most, I think first of all, we don't say it enough, that it's a right to health. I think we need to stress that and not, I think, to overcome a little bit this emphasis that is like an impact is coming, like you need to deal with that. So I think we need, it's first of all, I would say a message of narrative, and not just a narrative for narrative, because I think is empowering. Is empowering our climate action, our climate cause, if we say that. And then I think it brings in the fairness and the equity discussion in all the policy details that we can discuss. So I think it breaks a little bit all these dilemma in a way that we are all on the same boat. Yes, we are all on the same boat, but not everybody contributed at the same level, and not everybody is paying today the highest impact as specific climate vulnerable communities.
Thanks. Another question from the audience. Go ahead.
Yeah. My question is on migration, because no doubt in the recent past there's compelling evidence that most of the migrants coming into the EU are climate change caused from Africa. So my question is, what action, or is EU taking any action to support these countries and communities where we have huge migrants coming to Europe so that they can stay in their homes?
Obviously, we do everything we do with the programs we are managing are aimed at addressing the root causes of migration in Africa. And we all know the root causes of migration, starting with poverty. Obviously, there is, in some situations, it's not just economic migrants, there are also genuine refugees. We are working a lot on governance, peace and security. So I think the whole spectrum of our economic development programs, our development programs, are aimed at alleviating the root causes of migration. We are obviously trying to give specific priority to areas of origin where refugees are mainly, not refugees, migrants, let me use that term, are coming from. We do try to do targeting, what are the areas most exposed, and then we can reinforce our programs. We do a lot of work with UNHCR and also Red Cross and other organizations on supporting people in displacement. Let's not forget there is a number of people coming to Europe, but the majority of people displaced in Africa is in Africa. We spend a lot of money trying to improve the conditions, basic services, food security, health, education for people in displacement. And then obviously also we are working with the governments on both return and reintegration, but we are obviously also often accused of building up walls. It's not necessarily us from our perspective, but we do work on programs where we try to limit the possibilities of people smugglers to benefit from this horrible business. So it's a very broad response. We are often criticized for what we are doing. I actually think we are trying to do more good than bad, but obviously the press likes to look at the bad things. And indeed there are examples, and you probably, if you follow the discussions, we just had the Lampedusa announcement, a 10-point action plan, where we now have to scale up our engagement with 4 countries in Africa, Senegal, Ivory Coast, Guinea and Burkina Faso, to discuss with these governments how can we work better together to limit the migratory flows. 2 of those countries are actually not countries we are specifically keen on cooperating with right now, Burkina Faso and Guinea. We have just had military coups, etc. So how do we reconcile the fact we need to engage with people we would normally not like to engage with? So it's a very complex equation. Could we do more? Yes, if we had more money.
Thank you. I think I see one more question. Can we take one more question looking at the organization? One more question. Yeah. Short.
Thanks very much.
Sweet.
I feel guilty for hugging the mic again, and I've also setting myself up to be the least popular person in the room by intervening just before lunch. I suppose I wanted to make a couple of very quick points about the COP at the end of the year. First of all, 31 years after the establishment of the UNFCCC, we have a health day at a COP. So anybody from a health sector, I would encourage them to engage on the design of the health day, on how to take the increase in momentum on health at the climate COPs and continue to build on that. And second of all, I'd like to flag that at the Environment and Health Ministerial Conference in Budapest in July, Ireland launched a partnership looking at health sector climate action, where we're encouraging countries to join as we do deep dives into specific issues of where health sectors can do things. So we're going to have an event at the COP, and we'd encourage both countries within the WHO Europe and across the world to come along and have a listen and see what they can take home. And thirdly, just to, I suppose, reiterate our support for the COP26 health programme and the Attach initiative, and there'll be plenty happening on that front at the COP as well. So there's a lot happening for health sectors to bring to Dubai, and just to take the opportunity to thank the panelists for their interventions and to encourage everyone to go to that. Thanks very much.
Fantastic. I think that wraps everything up nicely as well. Great ending. Thank you for that. A hand for the panelists and lunchtime. Thank you so much. Really nice. I wanted to give policy paper.
Because I realized this is me before your lunch. Couple of points that I wanted to leave you with as we're all, processing this very rich and complex conversation that we heard this morning. We spoke a lot about the need for cross-sectoral cooperation and for breaking down silos, and I think actually this morning was a lived experience of that as we came across, from the health side, from the climate community. We had the scientists in the room, we had the practitioners in the room, we had decision makers from the different decision-making levels, and last but not least, the different geographies that were raised and spoke about here this morning. And for me, this morning was also very much drawing strength and inspiration from you and from each other. And I think that's very important, and that's what we need to do more often, as it is a dire subject that we're talking about. We're talking about these are not numbers, these are actual people being affected, these are communities being affected, communities being at risks. And so it's important that we keep talking, and also that we share inspiration and share on the good things that is happening, the change that is happening. But we also know, and we had it confirmed again this morning, that the change is not happening fast enough. It is urgent, and it keeps being urgent, that we act on climate, both when it comes to adaptation and when it comes to mitigation. And this is also something I'd like to leave you with, is to continue to raise the urgent need to act within your fields, within the people you speak to, with your decision makers, because that's the message that we continue need to bring. And in that, it is also paramount to continue to bring in the evidence and bring forward the evidence, the knowledge, the stories that we heard about this morning, and engage actually in the policy deliberations. And there are many opportunities, but there are also many needs for us coming from the different communities to do so. And I will just mention the EU levels, and this is where my organization mostly focuses on, and that there are, in the next weeks and months, there are important negotiations and deliberations taking place exactly that will, if we get to an ambitious outcome, that will help to strengthen people's resilience and will help us in adapting to climate change. So one is the EU Clean Air Standards, which is a key law on actually cleaning the air that we breathe. And we heard this morning how important clean air is in our way on tackling climate resilience. So there's very much a need, for the national governments to step up there and step up their health protection. So please bring this message forward. And also very much on protecting and restoring nature, which is another important debate that is currently happening at the EU level, where unfortunately some people want to continue with their compartmentalized thinking. Well, this has nothing to do with climate change, and this has nothing to do with our health. This is, additional Green Deal legislation that we don't have time for at the moment. And this is the wrong approach, because again, we've heard this morning how it's all connected. And nature, a healthy nature, is very much the foundation that we all depend upon. So it's crucial that we protect and restore nature in our efforts on adapting and on mitigating climate change. And so we also have this opportunity very much with the new EU Commission. The EU elections are coming up. Decision makers are looking actually onto the next cycle. Our conference has very much focused on the 2030 agenda. So this is something where I think we have many needs and opportunities to bring in health. For example, I would like to see very much a clear health priority in the next EU adaptation strategy. It's mentioned, but it's not one of the priority actions. I would also like to see really a mandatory requirement, or making health impact assessment and actually assessing benefits mandatory, because at the moment it's not. And this can be then for all guidance documents that are being developed. This can be for the adaptation plans, but this also very much, includes mitigation efforts such as the national energy and climate plans, where we need to see a much stronger focus on health and health protection. And last but not least, on finance. And with that, I would like to leave it here and actually put out a big thank you. Thank you to all our presenters and our panelists for your rich interventions and for the many food for thought you've left us with this morning. I would like to thank the Anvil management team at Cicero. I would like to thank the HEAL team for your support. I would like to thank the technical support and Norway House for really hosting us here in this wonderful location and for your support. And last but not least, big thank you to all of you joining here this conversation in person and also online. And let's keep going to really put health at the center of climate change action. Thank you very much. And lunch is out.